And Christine, whenever I go off track, just tell me where I'm supposed to go, and that'll be fine. Okay, please? So we have called the meeting to order. Committee business that I can remember off the top is we have to do the May 2nd minute approval. Is that correct?
Yes.
So has everyone had a chance to look at those? And no, May 2nd. We haven't done May 2nd yet.
Okay. Correct.
Yeah,
Yeah, right. We have two.
yeah, we have two, right.
You may have received the May 4th, because he's not in here. Okay, you did receive those. I don't know if you're ready to approve those. You
Yeah.
could put those committee bills.
I haven't actually finished reviewing them yet.
Yeah, that's what I said. So we're going to be one, but May 2nd we could do. If we have a motion for that, that would be great.
I'll move approval of the May 2nd minutes.
Okay,
Second?
okay, it's been motion made and seconded. Any discussion? Okay, seeing none, all those in favor, do we say aye or raise our hand? Aye.
Aye.
Okay. Motion carried. The May 2nd minutes are approved then, so that's great. I know in the packet there were several things. Do we go over any of those or just let the individual members read the couple of the questions that were asked?
Yeah, I can briefly tell you what's in
Okay.
the packet. So you have the agenda for Thursday, which should be on the top there. You have the answers to the couple questions that were not answered, along with a handout from Deschutes County. We've got some information on their public safety levy and dates. Again, the minutes for the board printed there. You may probably receive them by email. An ad request memo that H&HS is going to talk with you about, so I'll let Zach get into that more. And then we had a request for a service option sheet summary, adding a leverage column, actually 3 little columns there to the right, so that you can tell at a glance if those forms have leverage and which type of leverage. So I'm giving you that summary.
Okay. Thank you, Christine. So, okay, so we've got that. Is there any other committee business or can we move forward with?
I'll just mention that we are expecting our chair to log into Teams potentially to listen to the meeting, so you might see
Oh, okay.
as we let her in.
Okay, perfect. She does. All right, then we'll move forward in with the Health and Human Services. Easy for me to say. Or, anyway, Eve, would you like to, I assume you're going to start for us, correct?
I will start, and I will mostly play the role I did last time,
Okay.
which is to sit here and admire the work of the folks who run the divisions. But I will, maybe if you do want to just give it. Great. So we are, as mentioned at the meeting last week, we're talking about the other 4 operational divisions within Health and Human Services today. So that is the Community Health Center, Human Services Division, Developmental Disability Services, and Public Health. And we will be talking about, particularly when we get to public health, changes to our general fund ask from last year, decreases to the general fund ask. And I want to just preface that by saying that there are some funds that we have identified in order to reduce that ask that we believe are pretty well sustainable. And then we are using some one-time funds where it is our stretch goal to close the remainder of the gap through additional types of revenue generation. We'll get into some of that in the presentation today. But just want you to know that we are not today presenting a structurally balanced budget. But we wanted to really push ourselves to go as far as we could in service of the broader community need with the deficit in the general fund. So with that, I will turn it over to Zach.
Thank you, Eve. So with that, the H&HS budget is comprised of state funding, federal funding, fees for service, local revenue, and some major categories, and some general fund support. The general fund support's about 3% of the operating budget, which is almost 25% of what was in the current budget. Now, as mentioned in the budget message last week, when we entered planning, we were going forth with, as Eve mentioned, tried to look at ourselves and see where we had unrestricted dollars that we could supplant some funding the general fund had historically provided. So with that, we estimated the savings to the general fund to be about $2.5 million. And the fees and charges specifically, that is a kind of a testament to the growth of the work that's coming out of the FQHC. So as Suzanne will talk about later, proposed growth and I guess foreseen growth within the community health centers as we move forward. So with expenses, I will mention, to also Eve's point, although general fund savings have been identified, the FY24 proposed budget also does use one-time resources to fund operations, and that'll be touched on later. The significant amount of federal revenue and state resources flowing into the department are waning, so we will see some big changes in some of the proposed budgets, and the predominant factor in that is that those ARPA dollars, COVID dollars are phasing out. So with that, the expenditure budget has decreased by 3%. We are seeing personnel increases as the cost of business seems to be into the new fiscal year, while our M&S materials and services have decreased. So that's in alignment to some of the federal and state funding sources that are declining. And finally, as Christine mentioned in your packet, there is a budget add memo for the Human Services Division. I will state that budget planning is an iterative process, and we use the best information we have at the time. And in between March and now May, we've received clarity on the governor's executive order, the all-in executive order. So the budget add is to increase our budget in the Human Services Division in alignment with the executive order. I'll transition to public
Shall
health.
I join
Yes.
back over here? Okay. Great.
You have this all arranged, thank you. Thank you, I'm Jocelyn Warren, I'm the Public Health Manager, and I'm going to be presenting on the Public Health budget. Public health is focused on preventing disease and injury and promoting optimal health through regulation, programs, and policy interventions. Some public health services may not, on the surface, appear to have a strong connection. Some people will ask, well, why is nurse home visiting in the same division as restaurant inspections? The answer to that is public health programs are focused on the population health. So we're looking at health promotion and prevention at the population level. Our focus, therefore, is like the community rather than individuals. And in programs that deliver service to individuals, such as WIC, the goals are still population-level goals. And in the instance of WIC, for example, the goals are to improve childhood nutrition in Lane County and prevent low birth weight. Of course, what public health is best known for now is infectious disease, both surveillance and response, and that continues to be a major focus area, and of course will always be core public health services. Our current, the FT that is proposed in this budget is 138.85. Our budget for proposed fiscal year 23-24 is $28,458,000. Expenses at $28,666,000. Just as a note, I would like to mention that when I started this job about 8.5 years ago, our budget was about $10 million. So it's changed quite a lot. So I'm not taking credit for that. That's a lot of COVID. Next slide, please. So the big, what's happening really for us is that in our next fiscal year, we're still driven by the COVID response in a lot of ways. But after 3+ years, we are sunsetting our COVID-specific vaccination and testing efforts. So rather than being standalone programs, which they have been for some time now, COVID will be rolled into our communicable disease program with other respiratory infections that we monitor. We are taking forward, though, lessons that we learned during the pandemic, including the need to focus more directly on eliminating health disparities, which are the preventable differences in health outcomes experienced by socially disadvantaged and marginalized populations. So we will do this through the Community Partnerships Program, which continues to build relationships and connections with community-based organizations, and through expanded health communications, which has really been a bright spot for us in our ability to expand that capacity. We now have a communications team that ensures our messaging is culturally responsive and reaches a wider audience through social media. We are also focusing on expanding mobile services that have been dedicated to the COVID effort but have the potential to take public health and other services out to the areas of the community that are not now being well served. Finally, the other big change on the horizon is the Family Connects program, which is universally offered home visiting for new parents. We delayed implementation of this program during COVID, and I think I mentioned it in our last presentation, but it was delayed because of COVID and will likely launch sometime around January 2024. Thank you. Then other key initiatives, in addition to the mobile services, and the clinic is actually pictured up there in the top left, and it's quite a lovely piece of equipment. We are working towards health equity. We continue to implement public health modernization, which, just in a few words, is both a state and national initiative to update public health in general and to support larger health system transformation in our country. And we also want to mention the Public Health Reserve Corps. During COVID, we were the only large county without a medical reserve corps, which made staffing mass vaccination clinics much more difficult than it had to be. And our goal with this reserve corps is to ensure also that we are recruiting bilingual and bicultural volunteers and creating opportunities for practice that will ensure that these teams know county procedures and each other and are ready to respond to emergencies. Okay, next slide, please. For the strategic plan, I will highlight the Climate Justice Initiative, which is a new program and is working with our emergency preparedness team to build community resilience, especially in rural areas. And then also in terms of organizational health, we are prioritizing financial stability. As we come out of COVID, it's been quite an experience to expand so significantly and then also kind of bridge to what public health looks like post-COVID and post-pandemic. So we're also busy writing grants and seeking other external revenue to support services. Next, please. So that is connected to our future challenges and opportunities. So we are having to use one-time funding and reserves to bridge the transition to a non-COVID funded health department. There are also a few unknowns. In reviewing revenue and expenses, we know that expenses in the environmental health program are outpacing revenue. So we depend on fees collected in environmental health to support the program. So the fees may need to be updated. So we're exploring that right now and providing some different scenarios for what that might look like. We also don't yet know what the state investment in public health modernization will be for the next biennium, but that will hopefully positively impact the revenue side. So looking forward, we want to use this expanded mobile capacity that we have for more than COVID. We need to continue to address racism as a public health crisis, and we'll be doing more with community engagement, including a website soon, and elevating community voice. We are planning for the next community health assessment in 2024, so there will be a lot more coming about that to the board. That is a very intense collaborative process with our community partners that then leads to the Community Health Improvement Plan, which is a comprehensive community health plan that guides not just our work, but also the work of our CCOs and other health system and community partners. So there will be much more to come on that in the next year. And of course, we'll be phasing down the COVID response efforts. That's really what I have. I'm happy to take any questions.
Any questions for Jocelyn? Commissioner Buck?
Thank you. Dr. Warren, do you see the mobile services at stages for just events in different areas of the community, or are they there on a regular basis for visiting with schools on sites, or how do you see that really growing and being instrumental? Specifically, I'm thinking through the lens of rural communities.
Absolutely. Well, the rural communities absolutely are our priority with the mobile unit. That really is the dream, be able to take resources out. What it exactly looks like is going to depend a lot on our funding, honestly. So we are applying for different funding sources that would prioritize, for example, STI testing and treatment, which is a huge need in our community. So then they would be used primarily for that. I think our original vision was really thinking about, and this is something we still want to get to, there's a lot of capacity, so it doesn't have to be one thing. It can support multiple types of services out in the community. Right now, when they're doing COVID testing and treatment, COVID testing and vaccination, they do take other services with them. They'll take a WIC certifier out to the community or partner with their Human Services Division and talk about enrolling people in OHP. So they do provide other services. They're not services that we provide, but we're collaborating to make those available. But what I would love to see are clinical preventive services increased in our community, because when we talk about health inequities, where we really see the greatest inequities are in chronic diseases, and those are the most impactful in our community. That's what's killing people, honestly. So if we really want to address health disparities, we should be looking more at how do we identify people with chronic disease more quickly in our communities, especially those who have the least access, and that is going to be in our rural areas. Primarily, there are a lot of access issues around there. I also think there's a lot more opportunity to work with our in-house populations and expanding services in that direction too.
Commissioner Trigger?
Thank you. That makes me think, do we carry Narcan on the unit, and is there any intervention or counseling or access to addiction treatment?
That's
on
a
the
good
mobile
question.
unit?
I don't know. I mean, it really depends on the event that they're going to. I know that we have collaborated with opioid prevention staff on some events. I don't know if that is typical. I can look into that for sure. And absolutely, that is an opportunity, especially as some of the bills go forward in the legislature that make that more possible on the vehicles. And that would be, we do know that a lot of our public health staff carry Narcan. So they may have that as just a course of their regular services available.
Anything else for?
So I
Okay.
think the final thing that I just want to just put an exclamation point on in terms of the one-time funding is that we really do have $700,000 to $1 million in the public health budget that we are covering from reserves. We're working really hard. We are looking at what can, of course, fees and services, which you mentioned. We are looking at what additionally can we bill for within communicable diseases. We are looking at what can we bill for mobile services. We are looking at state funding for nurse-family partnership as well as modernization, growing volumes in WIC. Lots and lots of opportunities here to look at in order to close that gap. But this is certainly a risk that we are taking in putting this budget forward, reducing our general fund ask before all of the dollars are in the bank. So I just want to highlight that and make sure that folks know that although we see opportunities to close this gap, we have not done that yet.
Okay. Thank you very much.
Thank you. Next.
Good afternoon, everybody. My name is Suzanne Roloff. I'm the division manager for the community health centers. I've been with Lane County just over a year now, and I was told today I'm not allowed to call myself new anymore. But I said as long as we're doing something new, then you can still be new, and this is new for me. So, community health centers. We are 6 clinics throughout the Eugene-Springfield area, soon to be 7 next year with the addition of South Lane. Within our clinics, we have physicians, nurse practitioners, physician assistants, nurses, behavioral health specialists, community health workers, medical assistants, LPNs, and a lot of staff to help support, representing about 200 employees within Health and Human Services. The mission for us at the community health centers is to improve the health and wellness of our community through access to affordable holistic health care, really looking at the whole person. What are all of the needs and the resources that our patients may need to be connected to in addition to their medical care services. Our proposed budget is just over $45 million at $45,281,959 and expenses just shy of 44.8. Changes for the 23-24 recruitment. We are a revenue generating division, and we take $0 from the general fund. So all of the community health center revenue is generated from the community health center through grants, fee for service, and it's pretty, grants and fee for service, yes. We are trying to expand and grow. We are always looking to add new providers. The more providers that we have, the more patients we can see. So we are in a growth mode over the next year as well. Large change next year, we're going to change our electronic health record. and that is a big, big undertaking. We've partnered with Ochin, who is a national company located here in Oregon, to be our partner in this transition to Epic. Epic will allow us to meet a lot of our strategic goals over the next 3 to 5 years, including enhanced analytics. The biggest thing for me, I think the biggest changes are a great patient portal for patients to be able to access us, access information about their care. And the second great piece is the continuity of care and the availability of records from other Epic partners across the country. In our post-pandemic recovery, because COVID is over next week, we were highlighted on our preventative services. Lots of folks delayed their health care during the pandemic, and so we're focused primarily on well child checks, increasing our cancer screenings, and then looking at population health management, social determinants of health that influence the resources that we spend, diabetes care, hypertension. Those are all areas of focus for us over the next year. Some of our key initiatives, a really great collaborative effort happening right now in our Medical Assistant Apprentice Program. This is a partnership with AFSCME and funded from United We Heal, and we are going to build our own training program for medical assistants. It's something that other medical companies in the community have done, including Peace Health and Oregon Medical Group. We have quite a shortage, as you know, physicians nationwide, and here in this community, medical assistants and nursing is an incredible shortage. So we're going to train our own. It's a very unique collaboration with online training and in-clinic work training, and that is launching this summer with our first 5 medical assistants. Those students will commit to staying with the county for at least 2 years as we work with them. Epic South Lane, our favorite project over the next year. Yay. Our South Lane project, I'll call out, is not in this budget. So at the time that we were preparing the budget, we didn't yet have the final funding grant, and we don't have a definitive timeline yet, although 2024 is definitely when it will happen, just not sure when. So as that happens, we'll bring forward a budget for you to demonstrate the revenue that South Lane will generate and what that's going to cost us as well. So that is not in these budget numbers. I'm very excited about South Lane because of the unique collaboration. It has community partners involved, Lane Community College, the Cottage Grove School District, and several community partners down in Cottage Grove have been a part of this developing of this clinic. Another unique educational opportunity for students to have classes at LCC and then also in the afternoon have clinic time and internships within our medical clinic there. So win for education, win for rural community care access, win for the community. So very, very excited about that. Our other big highlight that I'll call out is our workforce well-being. Healthcare workers are pretty tired over the last 3 years. COVID has been an unprecedented impact to everybody's well-being. So the community health centers have been focused on our culture change over the last year, being very responsive to the staff and hearing what they need, what they're lacking, and how do we help them avoid burnout for the future as we continue to grow. The quantity of change that's happened to employees within the healthcare region cannot be understated over the last 3 years. It was continuous, constant, and having some time to level set and stabilize is very, very important before we do our next big changes, which will be epic. Medicaid redetermination is another big one. Coming out of COVID, Medicaid had put pause on everybody being determined to be eligible for Medicaid. And so all Medicaid recipients have to go through redetermination over the next year. We have a team of folks within the CHC that will be helping our patients go through that process and supporting whatever they might need to determine if they still stay eligible for Medicaid. We aligned to the strategic plan for Lane County in these 2 major areas, equitable and integrated healthcare and resilient infrastructure and workforce. Again, some of the things there that we are working on to align to the strategic plan. And our future challenges. Dr. Warren mentioned mobile expansion, and so that is on our horizon within the CHC, likely not in the next year as we focus on South Lane and Epic, though we are looking at some collaboration with public health related to using the mobile unit to start our presence in Cottage Grove prior to the clinic opening, and looking at the possibilities of what we could do before our clinic doors open to get the community used to us being there. Recruitment. Did I mention the physician shortage nationwide? There are some statistics that speak up to 40 to 45% of physicians have either already retired or will be retiring in the next 5 years, and they're not graduating enough from medical school to keep up with that. So we are looking at other ways to partner with the medical organizations that exist within the state. Western Oregon University, we're talking with them about having students come to us this summer. We already do nurse practitioner students from some of the schools within the state, and those nurse practitioners, several of them have continued on as employees with us, looking to partner with OHSU. And I know there's talk in the community about Peace Health hopefully maybe developing a residency program. It's very hard to recruit in if you haven't had residents in the area. And so that is our challenge from a physician recruitment standpoint. We are having success recruiting nurse practitioners. And of course, we already talked about the medical assistant program. We're going to solve our own problem of not having enough medical assistants. That's it.
All right.
And so one more thing that I will add is that not only does CHC not take general fund, but CHC is generating now excess revenue. So that has happened for some years, and our amazing CFO has put that in a bank because South Lane Clinic is likely going to run at a deficit the first few years. So we have that reserve in place to handle that deficit that is anticipated. But then the 1.5 million in excess revenue that we are projecting to close this year with, we were able to take and move over to communicable diseases. So that is the ongoing revenue that we shifted to public health that we anticipate being able to support public health in the future. It is then the million beyond that we have some question about. So this is a revenue generating unit for us, and really our strategy going forward in terms of our ability to further self-sustain health and human services is reliant upon this growth that Suzanne is talking about within the CHCs, the FQHC more broadly, which involves behavioral health and portions of public health, but really it's focused at this moment in the CHC.
Thank you. Do we have any questions? Commissioner Park.
Just briefly, and this is probably not for this meeting in particular, but Western University, how aggressive are we with them as far as recruiting their graduates?
We have recruited some of their graduates. We have worked with some of their nurse practitioner students, and we're just in the early stages of talking to them about medical students coming in their third or fourth year into a pseudo residency in one of their rotations coming to the community health center.
That's good for now. I'm just kind of curious as to, we have professionals graduating just a few miles from us, so they should all come here.
They, of course, go off to residency somewhere else in the
Yes, well,
country
we have that
as physicians
Yes, we do.
graduate. So working, as you mentioned, working with local partners on that, but there is no local residency program today. They are also starting a QMHP program. I am on the board that is overseeing that program and the development of that program. So we will be very tightly intertwined as they grow.
Excellent. Thank you.
For the great, Commissioner Trigger.
Thank you. On a similar line, it made me think, it's jogged my memory. I'm really curious to hear more about this training, this sort of growing our own program that you're talking about, and that's for medical assistants?
Medical assistants.
Do you, well, you might not, but do you remember last year when we did our community grants program with the ARPA dollars, the single largest recipient of that was Peace Health for a nurse for their own sort of grow your own kind of program? How or does that work together, or what other entities in our community are doing that kind of thing in the healthcare field specifically?
There are several that are doing it. Oregon Medical Group is also doing a medical assistant residency program. There are partners at FQHCs up in Multnomah County, Clackamas County that are also, I had a presentation not too long ago from an FQHC in Washington that is now, they've built their own program and they're going out and offering the program to other FQHCs. So it really has sort of become almost the norm. LCC, as I've met with them, has the capacity to double the number of medical assistants that they have coming out of school. They don't have the students who want to go into it. And the barrier there seems to be a few different things. The cost, of course, of attending college and getting through that certification, and then the wage and the jobs when they come out seems to be the barriers of why they don't have enough students to fill the capacity that LCC could do. And so we're trying to take away at least a few of those barriers and see if that helps.
Thank you.
What's the timeline for that program?
The job postings, I think, are this week will go out, and we're hoping to bring them on, the students on the 1st of July, right around there.
Commissioner Lovell?
Thank you. I'm going to ask a question that's kind of one of those elephant in the room questions, and I don't mean any disrespect whatsoever, but I really kind of have this feeling that as we move forward as an organization, I think what Mr. Mokryski said the other day in his budget message, Lane County is at its best when our people work together without regard for narrow interests, but rather with deep care for the common good of our communities. Is just a foundational pillar statement to where we're headed. And my question is for the Health and Human Services Department is, as we've seen during COVID, we had people who were heroes one day and villains the next within our hiring forces. And we as people and as an organization are going to have a long haul for that brand to change, that people can trust us to be a culture that has their back. And so my question is what kind of culture are we looking at developing, considering many of the reasons that caused the burnout we're now enduring through?
Good question.
Sorry, that's how I roll.
You want to do it from an HHS level, or?
Sure, so I think inclusive, collaborative, and supportive, and we continue to, when you look at not always our wages, but certainly our benefit packages, as well as quality of life and work-life balance, we have more to offer, which is actually why, particularly in the community health centers, we have seen an uptick in folks shifting from private sector jobs in this community to the community health center clinics in Lane County. And that is a testament to Suzanne and to Janet and to the cultural work that they have been doing in order to improve the working conditions within our health centers so that folks are feel supported within our environments. I think that more broadly in healthcare, there's lots of work that needs to happen in making these careers sustainable for people. And I think in terms of how we are viewed in the community, I think generally speaking, healthcare workers are still viewed highly in the community, and I think that there are pockets where that's not the case. But I think generally that's true. Where we see the greatest challenge related to that is actually with our qualified mental health providers or behavioral health professionals, where there is a lot less status in that profession, and that impacts our ability to recruit folks into it. But I think that most healthcare professions still have a fairly high status in our community.
I would add that from an operational standpoint, as I'm looking at our staff and our providers out at the clinic, it has been a lot of listening and collaboration over the last year. That is somewhat of a shift for some of the staff to be engaged in problem solving, and that has really helped, I think, have them feel empowered and have them feel supported to do and continue to do the work that we do. We have a challenging job today to do, and we don't have enough people to meet the demand that is coming at us. I think we figured that we would need at least 20 more providers to meet the need of the patients that want to see us. So that's a huge gap. So we just support the people as the best way that we can to do the job that they're doing. I hope that answered it at least a little.
Kind of. You're heading in the right direction. I guess maybe the second follow-up question would be, what are we prepared to do for, I hate to even use a church term, but repentive bridge building to the people that may have been burned by us? I mean, I hear what you're saying, but I also have a good many people that have come to me with concerns about, okay, so there's a section of people that were basically ostracized for how they believed the positions were on some things that we took. How are we going to bridge that gap between those people to, I mean, there's people out there, I think, that are qualified to fill the jobs we're asking, but how can we repair that relationship, I guess, is the real question I'm asking.
So are you asking about vaccination requirements and healthcare workers specifically, or more broadly?
I'm basically asking just about the way that the business as a whole is being, has been whittled down to where it is now, and it was because of a lot of disagreement about how things were handled or what people believed in a certain time period. And I'm wondering if we as a county, based on what Mr. Mokrzycki's statement was, which I really am rallying around, is how are we as a county going to know that when we hire people, we have their backs if they tend to disagree with something we have? That's a concern with me.
Sure. So I would say that the crisis related to staffing and healthcare accelerated during the pandemic because of an acceleration of individuals leaving the workforce, but this has long been forecasted. We are in a situation where the baby boomer generation is leaving the workforce, and there are not enough individuals in order to care for all those folks who have a higher demand for health care. So I don't know that I would agree that without the pandemic, we would not be in this situation. I think it's possible we would have been in this situation in 4 or 5 years had we avoided early retirements. But I think this is a situation that we've been talking about it my entire career, forthcoming. Now, how do we build relationships with individuals who may feel unsupported by us? What I would say is that Lane County followed state requirements. And we have followed state requirements the entire time. And I don't know that I could look at staff who are coming into our organization in good faith and say that in the future we would not follow state or federal requirements that come forth. So I think that supporting folks in their beliefs, and I believe that everyone who submitted a medical or religious exemption for vaccination in particular, I believe all of those were approved. So we will support folks within what the laws and regulations allow us to do, is the very best that I can get in that. And Steve, you were here during that time. Do you have any other thoughts about that?
Yes, specifically related to the vaccination requirement, as Eve mentioned
I'm asking a general question. You guys are going to that. I just asked a general question, so I don't want to focus my question on specifically the vaccine issue that we had. I mean, the concerns that I've fielded with people asking me about the future of how we're operating as an organization is many people felt like they were abandoned and we didn't have their backs. And so I'm wondering now that we have this downturn in recruitment and challenges, single ones up there is recruitment, how are we as an organization going to put forth a culture of, hey, we got your back, we want you here, we're the best organization around? How are they going to believe that going forward when the overall brand of healthcare was hero one day and some people are villains the next? That's a tough brand to rebuild, and I'm just wondering if we have a strategy for that. That's my general question. Don't get off on the vaccine thing here.
Well, so I'll just say, I actually don't agree that organizationally, I mean, we track and we can get these numbers for the committee, but we track the turnover rate year over year. We're consistently, as an organization, consistently below the national average for state and local government turnover. Or somewhere usually around the 13%, 12 to 13% turnover, which is considered a healthy turnover rate. So that's organizationally. In terms of HNHS and the CHCs, I don't know specifically what those, but I'll just say I will speak for myself. I view Lane County as an employer of choice. I see that we have fared as well or better than many organizations, particularly in the public sector, both in terms of turnover. Yet have we lost some talent? Yes, every organization has seen, because of the competitiveness in the labor force, turnover and talent leaving, but our ability to recruit talent and retain the talent we have and the programs that we're investing in related to, our emerging leaders programs and career development within the organization, I would argue is at its zenith. So that's organizationally, and then maybe Janet, you have an answer just to the healthcare
Yeah.
recruitment and retention specific.
In October this year, we participated in a national survey that was sponsored by the National Association of Community Health Centers, and it was on workforce well-being. And I'll take a guess, I don't remember the exact number, I'd say 42%, but no less than 38% of employees responded to it within the FQHC space. And that response rate is statistically significant. So when we got our data back, I began to look at it at a high level, and I really need to drill down. But I was absolutely surprised by the affinity for the CHC and the FQHC. I mean, most of the answers were, I have no intentions of leaving this organization. And I was shocked by it, to be honest, because in my experience, that was really a high rating. And there were several, my leaders listened to me. And again, it showed well. And so what I wanted to do is drill down into the details of it to understand which sections of the FQHC. But overarching, if you just look at that at a high level, it's migrating in the right direction for whatever that represents. The other interesting thing, from my perspective, being here, 8-9 months, our providers routinely will go out and do a provider night. And so they were doing a provider night, and I didn't know all the providers. I said, gee, I'm going to see if I can't get access to this. And I emailed the provider who organized it. And there was a pause, and it was like, well, it's really the larger community we're inviting. But really what that pause was, is this provider going out and talking to other providers. Do we want our administration to be present at our provider event? An hour before the event, I got a communication saying, hey, if you're free tonight, why don't you join us? I couldn't do it that night, I will do it in the future, but she and I had a conversation, and she said, I have never, in the 7 years I've been here, had anyone from administration offer to socialize in the evening with the physicians, with the providers. So I think that helps create personal relationships, and then that word starts to spread throughout the community. Just like right now, we're hearing about some changes that have happened in the local practice community that isn't necessarily resonating well in the larger community, but has spillover effect that may be beneficial to the FQHC and the community health centers.
One final comment I would just make is that if you look back over the past 10 years, we've seen significant growth in the community health centers, right? We've gone from, when I started in 2014, we had 2 community health centers. We now are opening our 7th. So the focus in the last decade has really been on expansion. And when your focus is on expansion, you can't also then focus on culture building. And so I think we've been through some tough times in the CHCs over the past decade, but I would argue now, more than ever, are we at the cusp of really being able to invest in, and based on some of the preliminary survey information, and also we are doing a county-wide employee satisfaction survey in the coming months, so we'll hear more about that organizationally. But I think we're in a really good position to continue to build upon the positive culture, particularly in this area.
Yeah, and don't read in what I was not asking the question. I mean, I look around this room and I see people that I am just blown away and impressed by. And that's the reason I asked the question. I mean, you all have really, really sharp acuity to the job, the nature, the people we serve and all of that. And my question is this maybe if that's an afterthought or a forethought, where's that in the priority list was really the reason why I was asking that question, not to diminish anything about what we're doing or to criticize it, because I mean, you guys are running a great show, and I just think, we want to be the best that we can be, and everybody wants that, so.
And I would say that it is a top priority for us to care deeply about the people who work for us and to demonstrate our deep care for the people who work for us. And the only time that we would not support anyone in their personal beliefs would be if that conflicted with another requirement or our values, our core values as an organization, which are set by the board. So those are really the only times that we wouldn't absolutely go to the mat in support of our people.
Awesome.
Very good discussion. Commissioner Farr, did you have a comment or question?
Well, this has gone on a little long already, but I just wanted to, my impression is that the recruiting issues that are here in Lane County are universal. It's not just here.
Yes.
And we're having
This is
an-
not a Lane County problem. This is a nationwide healthcare shortage of workers problem.
And job burnout is not just Health and Human Services, I mean, job burnout across the board. So I think some of the things that we're experiencing aren't just here and aren't just our organization, but we are experiencing it. But one thing that Commissioner Lovell said is looking around this room, who better to bring us to it?
Yeah, set the example, the bar, yeah.
Very good. Thank you. And I'll just point out, too, that we had Dr. Ludke came to my Rotary group a few weeks ago, and it was, it's pretty much standing room only in our group for where we are, and he stayed after, he answered questions, and it was quite well received, and I think that is the type of thing we're talking about to a point to get out. And so one other quick question, since I know we need to move on. There's six community health centers.
Yes.
Where are they located right now? Because I don't really, so I can add that when I talk to people.
One downtown here at Charlottetown in the H&HS
Right.
building. Our Riverstone location is in
Okay,
Springfield.
I know where that one is.
We have one at the Springfield High School, our school-based health center.
Okay.
Our Brookside location is over southwest Eugene, Chambers and 18th.
Okay.
And then our Delta Oaks Clinic is up on the north end of town, up by Green Acres.
Okay.
And MLK?
MLK, sorry, I was like, that's the five.
Yeah.
MLK Primary Care Clinic is embedded in our behavioral health clinic over across from Onsen. That's our
Okay.
sixth. Thank you.
Thank you very much.
You're welcome.
That was, and then Cottage Grove, and the next one I
Cottage
assume will
Grove
be
and the next
West
one.
Lane County, right?
By the time I come next year.
Let's get that in there for you.
It only took 16 years
It
to
only took
fundraise for Cottage Grove.
Again, thank you very much.
You're welcome.
Great discussion, so,
Thank you.
thank you.
Okay.
Well, good afternoon. My name is Kate Budd. I'm the Interim Human Services Division Manager. And I oversee a division that has what I think is a really important mission to really work to improve the lives of those in our community and to help them be successful, whatever that looks like for them, with a particular focus on people who are low income as well as those who are unhoused. We do that through 6 different program focus areas, which includes Dovetail Coordinated Care, which works in partnership with our community health clinics, through our homelessness response, which includes data, coordinated entry, and coordinating over 60 different programs with provider partners across Lane County. Rent and utility assistance, which helps people who are low income remain stable in their housing. Workforce, employment and training services, and they really work to stabilize folks in their work that they do, and then also to help them move forward in careers so that they're able to increase the overall amount of money that they are earning. And then lastly, our veteran programs, which really seek to support veterans who are seeking to access the different programs for which they're eligible for through Veterans Affairs. So we have a total of 71 and a half staff members, full-time equivalent, and proposed fiscal year 24 budget with resources at about 46 and a half million and expenses at about 48 and a half million. So a few of the key changes between this current fiscal year and the next very much revolve around All-In, the governor's executive order due to houselessness. In total, that's approximately $18 million that encompasses the current fiscal year as well as next fiscal year, with dollars that need to be spent through January 10th of 2024. We also are experiencing a number of dollars ending within this next fiscal year. That includes the COVID dollars that have been referenced already, as well as a SAMHSA grant for folks who are frequent users of systems of care in our community. That'll be going away this next fiscal year as well. We also have been receiving wildfire survivor funds to help support the wildfire survivors who actually were just now completely housed, as Commissioner Buck mentioned this morning. And so those dollars will also be fading away in the next year. So a number of pretty significant changes for us. We're also seeing a reduction in capital expenditures. In the last few years, we have been working hard to rehabilitate the Navigation Center, the Schenkel Brooklyn Street Shelter, as well as a new office for our housing and community action programs. All of those now are completely rehabilitated and are working as they should, either as shelter or as an office for myself and our staff. And then we also are seeing a pretty significant reduction in the rent and utility assistance that we're receiving, particularly from the federal treasury. That had been a significant investment, and of course now that COVID is no longer a crisis, those dollars are waning as we go into this next year. So a few of our key initiatives include a suicide prevention outreach effort through our veteran program. There had been a recent grant that we were able to access, and the program was able to provide just key materials around suicide prevention, to provide gun lockers to veterans and their families to be able to keep firearms safe. And then also to be able to provide SAVE training, which is a training that is offered on a train-the-trainer type basis, so that the information around suicide prevention in veterans can be provided far beyond just what the county can offer. We also received a 5-year grant related to weatherization services. And this is exciting, recognizing that energy costs continue to rise for our community members, and that these dollars are providing direct cost assistance, not only with electricity costs, but can also help with providing a cord of wood, for example, or being able to help newly with water costs that our community members are experiencing. And then lastly, mentioned the Dovetail program being embedded within the community health clinics. These are healthcare, community health workers who are serving as peers or people who have similar experiences to those who are receiving assistance at community health centers, and helping them be guided through the different resources within the center, but also throughout the community. So we're excited about this opportunity. So I wanted to touch specifically on a few of the funds, the general funds that are supporting the Human Services Division. It includes around homelessness response, and being able to support a few community health workers whose focus is really on identifying those who have the highest needs in our community who are unhoused, and helping to move them into programs that have open spaces. One great example of their impact is that previously it could take up to 3 months to be able to identify someone for a permanent supported housing option that became available, and there wasn't just a key person who was able to be the main contact. And so now our community health workers serve in that key contact role and are able to be able to identify and move that individual into housing within less than a 1 month's time. And that is pretty impressive, considering most people need to have identification, they need to have social security cards, they need to be able to kind of share kind of what their housing experience as well as unhoused experience have looked like. And also need to be able to be interviewed in a number of different ways in order to be assessed. So it's quite a process, and our community health workers helped streamline that significantly. We also have been able to increase the number of users within our homeless management information system. Just in the last year, 148 users have been added. And I can assure you that those users are people who are utilizing the system on a regular basis. And if someone doesn't touch the system within a month, we move that user license because they are so greatly needed. And so also it's been able to help us have a system that very holistically looks at the needs as well as how we are across Lane County working to meet those needs. The general fund also supports a shelter program called Dawn to Dawn, and this is a shelter that provides approximately 144 people with beds each night, and it is very much targeted on moving people who are unhoused today into shelter within a very short period of time so that we can get them off the street and be able to connect them with housing navigation resources. And then we also have the Veterans Program, which receives general fund. And this is in the form of match because they receive state funds and those dollars need to be matched with local dollars. There was a recent PACT Act that was passed, and it allowed for veterans to receive additional benefits due to certain toxic exposures. And just as a result of that act, they have seen a significant increase in the number of veterans who are reaching out for additional services through their programs, and have been very successful in being able to help veterans access the financial resources that they're eligible for, and in fact, have been able to match their highest level of support in access to dollars since 2005, which is notable. So we do a number of programs that help support the overall strategic plan. A few that I think are notable is just not only working within HSD to collaborate. One great example of that is that within Workforce, they actually have a housing program that not only is someone receiving employment support, but they're also receiving help with identifying housing as well as stabilizing in their housing and receiving rent assistance while they continue to search for, find a job, and then stabilize in that job. But we also do that cross-departmentally as well. A great example is we now have someone from Lane County Behavioral Health who is based in the Navigation Center, which is an emergency shelter for folks who have high needs and are unhoused in our community. And that has been an incredible asset, as you can imagine, being able to connect those folks with someone immediately who has strong training and skill in supporting people in their mental health needs, and then also is very well versed in what behavioral health services exist here in the community so that they can be connected very quickly in many different ways. We also have been helping our partners in the community by providing them with pallet shelters, which are those small little huts that serve as either a one-bed or two-bed shelter for someone who is unhoused. And there are pallet shelters, over 100 of them across the county. And so we've been working very closely recently in just trying to understand, who would like to actually own the pallet shelters that are on their property. Many of them are faith-based entities. And then through All In, there likely is an opportunity for additional pallet shelters, which is also exciting. This has been a great way to be able to quickly create additional shelter beds for folks. So I've spoke quite a bit about the challenges, but there are a number of opportunities that are coming as well. One, for example, is the Dovetail integration into the Community Health Center. What we hope is that they will be able to access values-based payments through the federally qualified health centers, which would allow them to be self-sustaining moving forward and allow us to transition from our Centers for Disease Control grant that we're receiving now to this type of payment system so that it continues far into the future. We also are looking forward to the Medicaid 111 waiver. This is something that was passed this fiscal year that will start to go into effect in the next fiscal year. Housing will start June 30, I believe, maybe July 1st of this next fiscal year. And the benefits include 6 months of rent assistance, as well as housing navigation supports. And as you can imagine, those are resources that are well needed, not only within the homelessness response supports and supporting people who are low income, but across, our behavioral and physical health worlds. And so we're working really hard to try to integrate those benefits as greatly as we can, and be able to use them in a parallel way with the work that we're doing, so that we're able to just utilize the dollars available for a longer period of time, and also making sure that we're tapping into those benefits that people are eligible to receive. So we have much more to learn from OHA around those Medicaid benefits, but that is an opportunity on the horizon that we're taking a very close look at. Any questions that I can answer?
Any questions for Kate?
I can share, if I may. Commissioner Trigger had asked about Narcan, and a great partnership that recently was struck between our rural outreach team that is here internal to the county and the Dovetail Care Coordination team. They were able to create a policy that specified how Narcan would be used. That has been fully implemented, and then they just recently received a grant for approximately $23,000 to purchase Narcan to go out and be utilized through all of their work. So really exciting. We'll be able to do that at a much higher rate than we did even this year.
Through the clearinghouse, I assume?
Yes.
Yeah.
Okay, thank you. Is there any questions? Any other comments? Okay, thank you very much. Next.
Good afternoon, I'm Carla Tazamal. I'm the Division Manager for Lane County Developmental Disability Services. And so Lane County Developmental Disability Services provides services to individuals living in Lane County who have an intellectual or developmental disability. All individuals come through our division for eligibility determinations in order to receive authorization to access other Medicaid services in the community. We really focus on primarily voluntary services. Individuals are eligible from the point in which just shortly after birth, if they have the right, the qualifying diagnosis, as well as functional needs. And they may, most people remain in services throughout their entire lifespan. So we really provide broad-based services to a very large population here in Lane County. As I indicated before, we do all of the eligibility. So we look at whether or not a person's qualifying diagnosis and then scores qualify them for the services that we're able to provide. And we also conduct investigations of abuse and neglect for individuals in Lane County who have what's referred to as IDD, just for short, to make it a little bit less of a mouthful at times, so people who have IDD. Except for children who are for reports about children and abuse, those of course go to child welfare. And then we also provide case management for over 3,000 individuals. And we are the largest case management provider in Eugene, in Lane County, and we are the second largest in the entire state. So we are quite a large entity in terms of providing case management. And the case management really is that piece that I talked about from birth all the way through the lifespan. We authorize those services that people may need to be functional in their home and in the community and in employment. So we're not a direct service provider per se, but we authorize the services and develop the plans for people to access what are, for example, personal support workers who come in the home and they may help with things like housekeeping or attendant care, such as feeding, living, helping people go out into the community, foster homes, accessing those services, accessing job coaching services so they can be successful in employment. So it's really a broad base of different types of services. And we are the entity that authorizes those services in their plans. We also certify, we are the designee for certification and licensing for IDD foster homes. So that's one set of foster homes here in the community. And we provide support to different providers in order for them to be able to be employed. For example, the personal support workers, who are those individuals who are authorized by the state to provide what others know it as kind of home care services. They come through our office for all of the paperwork processing, and then we also process all of their time cards, which accounts for over 1,800 time cards every 2 weeks that staff are reviewing and essentially authorizing in the system so people can be paid. So it's really a large network of services, not only to the individuals, but also to support providers in this community. Our resources, as you will see, are $17.5 million around for this year, and our expenses are $21 million. This is a little bit confusing because we actually have quite a large fund balance from last fiscal year. There have been some investments made by the state, which has been very helpful over the last couple of bienniums, and that has allowed us to build up some funding. All of this funding has to be used to support the program specifically. It has to be used specifically to work with individuals with IDD. And it is all a mix of state and federal funds. None of the funding comes from the general fund here at the county. And so we do have plenty of reserves, essentially, to be able to cover the difference in funding here. We also have, we have now 152 FTE, so we have grown significantly, as you will see as we talk a little further through this presentation today. All right, so some of our changes. So I just mentioned it, but essentially FTE increases. So there was a significant investment by the state. The state funds us on a 2-year cycle. So every 2 years, which we're right in the process now, we won't know till June what our next cycle of amount of money will be over the next 2 fiscal years. But for right now, we are in a situation where they really invested in us in this work in the last couple of years. We were able to add a significant amount of staff, and it has been very, very helpful. But it also creates some different challenges. There's also, what we're really trying to do is look at all of these new staff who've come on board. Many of them who came on board really during a pandemic, which was really challenging, and really looking at ways we can help support them so that they do stay in their roles. We're really trying to be as flexible as possible to create that work-life balance, to help support them as they're growing as employees and learning what is a very complex job and a complex role. We're also focused on implementing and really developing right now an equity plan. This is a state mandate that is new this year, that we have to have a formal equity plan, which really is in line with the work we were already doing. So we're just putting it into more of a formalized plan. And we're doing work to support and recruit new providers. While we're not directly healthcare per se, the provider pool and the workforce shortages are real across many organizations and many divisions and many elements of work out there. And so it is also true for IDD. And for example, we've had a loss in the number of foster providers. During COVID, not everybody wanted to open their home to other individuals coming in. So there's a lot of reasons why this happened, but we're really looking to try to grow the provider network, in particular focusing right now on foster providers. We're just launching here pretty soon a campaign for foster providers for children, where we have a specific need. And then we also applied for an ARPA grant, and we're awarded funding to work with our community providers to develop a workforce video that the community providers could use. So it wouldn't be specific to increasing the staffing for our division, but really trying to increase the provider pool that exists of people we can refer to. And then kind of that piece I talked to about some of those challenges as you grow. We're a very different organization, I would say, than we were 5 years ago when we were half the size. Some of the processes and systems we used 5 years ago are no longer working as well. And so as a result, we're really looking right now at analyzing our systems and our processes to make sure they're as efficient as possible, and work with this new way we're needing to work with so many folks. And also, we have embraced telework, which creates a need for more electronic sorts of technology. So our key initiatives, as I already mentioned, equity and inclusion is very big for us right now. Part of that is driven by a state initiative. And then also we have a group of staff in our office who are very, very strong advocates for equity. And we have a very strong equity committee and feel very positive about the work that's happening in that arena. We are very focused, as I mentioned as well, on outreach and community connections. So this is that piece about trying to grow the provider network. But also, we're really looking at how are we getting out there and making sure people know about our services. The last 5 years, I would say we've been really responding. We've been responding to this influx of funding. We've been responding to people coming to us. But we know there's pockets, perhaps like in the rural areas or certain populations who don't speak English, where they may not be as aware of our services. So we're really now starting to invest more in going out. We have specific staff who now have taken on this role to make sure that we're presenting, we're getting information to the schools, to different community groups about the services and how to apply. And then go over here to developing and reinforcing infrastructure. It's that piece around we've grown so quickly that we've been responding, and we haven't really been able to take the time to look at what's the most efficient use of resources, what's the best way to process invoices, and with all of course, the concerns around budget, we really want to make sure, even though financially we're doing well, we also want to make sure we're strong fiscal stewards. And so we are really looking at all the opportunities we can to improve in those areas. And then employee onboarding and retention. We have committed quite a bit of time, I would say, over the last several months, last 6 months about, developing new ways of doing orientation, new trainings for staff, and I feel very good about that. We've had a lot of really positive feedback around the onboarding system that now exists in DDS. I would say there was a time where we were just trying to hire all these people, and now I think and it wasn't as seamless. People were coming on board without as much training, in part because they could learn from their peers. When you're only hiring a couple people a year, for example, when you start hiring 20 people a year, it creates a whole new need to do things differently. And then that is, of course, a group of employees. And what I'm referring to here is the Lane County Strategic Plan. So our connection to the Lane County Strategic Plan, I would say, is really strong around that strategic priority number 4, investing in employees of DDS. We have a very strong culture. The feedback I hear is very positive. And staff connect well with one another. They are very mission-driven. The majority of the staff who work there came there specifically because of the mission of the organization and the division. So we are in a good space. I think we may be in a better space than we have ever been in terms of the staff that we have, the commitment, and as well as combined with those resources. And then, of course, we are in this beautiful new building, which we moved into just last year. Been there about a year now. Thank you, commissioners, for all your support through that process. It was quite wonderful to move into a building where we had adequate seating and space for all the staff. At one point, we were sitting in the basement of this building, and we had staff in the copy rooms because we just literally had outgrown the space. And it also didn't provide the parking that we needed for individuals to come who needed our services. It wasn't as accessible. So we're in a really great location now. We're next to Lane County Behavioral Health, and so there's lots of opportunities to collaborate. And it's a good location for many of our individuals who receive services from both organizations, from both divisions. And then speaking to future challenges and opportunities, I would say it's similar to what I have been expressing, which is really just that incredible growth. Part of that was due to the increase in funding over the recent years, as well as an increased demand for services. There was a change in about 2014. A lot more services were available in the community and to people living in their own homes, which has driven, and prior to that, there was really more of a focus on residential or crisis services. But since about 2014, we've just continued to see an increase because there are so many more services available for people, for example, living in their own homes, and that's where we've seen the largest growth in service requests. And we don't expect that to necessarily change. You know, there's more and more people moving here, more and more children, you know, being born each year, and the services are relatively new. So we still are in a point where we're really growing and growing the population that's coming into services and that we're supporting, and that will continue to create new opportunities for us in terms of looking at how we can do better to support those individuals, how we can collaborate with our partners. I feel very good. Just last week, I believe, we received some funding from the state for a position, and it is a position that is going to be working specifically around ARPA funding and housing and people with IDD, and that position is, while it's funded by developmental disabilities and resides in that budget, it's placed in human services, so working closely with the human services team and the housing team there. So there's just looking at what are those ways that we can collaborate and become more involved, and people with IDD can be more visible in the community, and we can support them. And of course, as we grow, we're going to eventually need to hire more staff, which will continue to create opportunities in terms of space and where we're seating people. We have embraced telework, which has been very helpful to us. We are sharing spaces, sharing cubicles. We're doing all we can in terms of being as fiscally sound as possible with the funding that we have received for the building. We did, when the building was designed, plan for an addition because we anticipated that this growth would continue. And so we're looking at what point is that going to really be a necessity if the number of clients continues to increase and we continue to receive the investment in funding. And so those are the key pieces right now for DD.
Very
Any
good.
questions?
Excellent. Questions? You're off the hook right now.
All right.
Thank you.
Thank you.
All right. No, I think we have, are we done, or is that it?
That's it for us.
That's it, okay. All right, cool.
You're not done. You're done.
I understood that, actually. No, I obviously messed up because I marked off all the people. I must have missed one. Okay, what can I say? Thank you, everyone. Thank you. Oh, look at, I thought I was running behind because I thought there was one more. Now I feel good. Now there is break, yes, that's it. Yeah, so, all right, I feel really good now. Well, even ahead of time, so that's perfect, isn't
He
it?
said it's break, but.
Break time? No. You don't want a break?
No, we're having a break. I'm sorry, you just said that.
There are snacks and,
That's what you want. we have Mr. Hurley here. Hi, Dan.
Hello.
Dan are in Rotary together, so we have spent a lot of time together.
Is he going to lead us in song?
Yes, you want to lead a song for us, please?
Beat me to it, Moog.
He is our song leader, you're right.
Give him a bragging butt.
And one quick thing that I was going to bring up from Christine is that on the mics, that I think I forgot to do it up front, that they are very sensitive, and so rustling paper in front and things that does make it hard for the people that are out to hear stuff like that, so
Thank you very much.
there we are. So Dan, it's your show.
Okay, well, good afternoon, Budget Committee, Commissioners. Thank you for your time here today. And Budget Committee, thank you for your service. I know it's a lot of work, a lot of hours putting into this, and appreciate all you do for the community through this. Would also like to acknowledge our budget staff,
Yeah.
downtown that have been such a help, and our internal team led by Paula Davis, who's here. And then we have folks watching, Fahad Kazi and Suzanne Mueller in her last year doing this, and Kathy Howard. They do all the hard work so that we just show up and talk. But really appreciate their efforts. It's been a really smooth budget year. So excited to share our budget with you. The budget is what makes all the amazing work happen. And this year, I appreciate that we're doing a more narrowed focus, and instead of talking about all the amazing services we do, which is really hard to fit into the time, we're going to be very budget focused. So we have 3 division managers here with you today. We have Jeff Orlandini, our waste management division manager, here to talk about we're doing a higher than CPI fee increase, so a 7% increase that'll take effect at the beginning of the fiscal year. Brett Henry with Parks will be talking about all the exciting things that are going to happen with the new money coming from the Parks levy. And then Keir Miller is here because we have a less fortunate story with an unbalanced structural budget, looking at about a $1.4-ish million gap that we need to close in future years. Behind them, so that we'll be hearing from them today. Behind them, we have division managers Oren Schumacher and Paula Davis and Peggy Kepler, who will be retiring soon. They all share the road fund. I'll be talking about the road fund, and just because that's such an important part of public works, it's about 43% of our funding there, and some concerns that we have for the long term of the road fund. It's structurally balanced at this time, but some definite concerns there. So that's the team there. We don't have Lane Event Center here, Corey Buller, the division manager there, and General Services, Michael Johns, that includes our fleet and animal services, so you won't hear from those today. So getting to our resources, we have about $143 million in resources, which includes incoming revenue and transfers. The department's very heavily dependent on fees and charges, and then state and federal revenue, you can see making up the bulk of the funding that they're coming in. So waste management has the bulk of that through fees and charges, that $21.8 million. That's our tipping fees. When people bring their waste, that makes the operation run. Fleet, $13.7 million. Those are internal transfers for people renting equipment through the replacement fund and usage charges. And then land management division, very heavily dependent on fees for the permitting, building, and planning permits. And Keir will get more into detail on that. And then federal and state revenues, the bulk of that comes what's called the highway allocation. That's through the gas tax, 31 million there. And then construction reimbursement. We do a lot of projects for other agencies. We're an ODOT certified agency, so we're able to carry out projects on behalf of other agencies and receive revenue in that way. And then just wanted to point out general fund, even though it's a small amount, we do have one area of public works, our animal services section that's within general services, that's fully reliant on the general fund at about $634,000 there. And then looking at the other side of the coin, our expenditures. Our expenditures are projected to be up about 19% next year. That's driven by a number of factors. So personnel up about $3.7 million as we've finished contracts that carry with them COLAs and market adjustments for our different labor groups. We have 3 different represented unions within Public Works. Materials and services, we've seen just a number of increases across the board. You all see it out in the community. Just to point out a few of them, the oil that we use for our chip seal program, that's up over 60% over the last couple of years. Asphalt and rock that we use for all of our road operations is up almost 50%. So that's going to be a struggle to keep within CPI for Public Works, particularly in those road fund areas. Our capital expenditures are up almost $2 million. That's due to a variety of projects. Peggy Kepler could talk, but I think we have over a dozen projects in the next fiscal year, and so it's just a number of projects. Our capital expenditures on the waste management side are actually quite a bit lower as we've wrapped up the landfill cell that was about a $18 million project over the last couple of fiscal years. So you can see the capital expenses by fund, primarily they're in the road fund at almost $30 million. Wanted to highlight Parks has a $4 million project coming up to upgrade the sewer systems and 4 of our larger projects. That's coming through some ARPA money that we were fortunate to get. The fleet fund, $6 million, that's in capital outlay. We have some very expensive equipment that we purchase. Our compactors are well over $1 million now. And Lane Event Center has some improvement projects on restrooms and fire doors, and there's a small amount in waste management for some smaller transfer station projects. And from here, I'll pass to Brett with Parks, and then I'll be back to talk about the road fund in a bit.
Good afternoon, Budget Committee, and thanks, Dan, for the introduction. So the Parks Division, taking a look at our services and our facilities that we have within the county. We have a total of 66 parks now that we operate and maintain. We also have 5 campgrounds and 3 marinas and 3 covered bridges, which I'll talk more about later. So when you look at our park system, it encompasses a very wide geographic area from the Pacific Ocean all the way to the Cascades, about 4,600 square miles. And within that park system, we have about 4,500 acres that we manage, and of the 850 of those acres are natural areas. So with our natural areas, we're working on preserving the habitat, and so we have a number of stewardship projects going on with those. We also have a lot of day use facilities, as you can imagine, restrooms, we have pavilions, we have trails, we have those wonderful revetments, and so we have lots of facilities that we manage well within the park system. Lane County Parks is known for our access to water. We have a total of 33 boat ramps or boat landings, and we provide access to 3 of the main rivers, the Willamette, McKenzie, and Osagusla, as well as 5 lakes and reservoirs. So getting more into the budget and some changes for the next budget cycle. Fortunately, as Dan had mentioned earlier, a 5-year local option levy was passed by the majority of the voters. So yay that. So this though is only for 5 years, and so we need to think about that. I'll talk about that more later as far as just becoming fully sustainable as a park system. It's estimated that we'll receive about $31 million over that 5-year period, and it provides a lot of resources for the parks. So we're really working hard to tackle our deferred maintenance backlog. It's estimated to be around $28 million within the park system as far as our known deferred maintenance. And with the levy revenue that's coming in, as well as the ARPA funds that Dan had mentioned earlier, we hope to reduce that maintenance backlog by about 60% over the next 5 years. So hopefully everything works out. We also are going to be using those resources towards improving the security and the safety of our parks. We're looking at our habitat within our natural areas. We have about $1.5 million to devote towards that, as well as partnering with other agencies to provide environmental education programming. So for this, specifically the next fiscal year, We have an estimated about $5.9 million coming in, and that will provide resources for an additional 10 full-time staff. So we're going to go up to 29.8, and I know that's kind of an odd number, but we have one employee that's a 0.8, and he did a great job. So the levy fund, we want to make sure that we're completely transparent, and also just for accounting purposes, we have divided that up into its own separate fund called Fund 295 and separated it from just two existing operating funds, 216 and 217. So looking at some additional changes, the American Rescue Plan Act, actually we were able to get about a small piece of that pie, but $4.3 million, which isn't small, it's a lot of money. And so that will go towards water and sewer infrastructure improvements. We're looking at 4 parks, as Dan had mentioned, Armitage, Baker Bay, Orchard Point, and Richardson. Also, I want to mention Armitage Park because we are planning on doing a campground expansion there. And so we're going to need to improve that capacity of that infrastructure there as well. So some of that money will be used for that. So, as I mentioned earlier, we received this levy, and that's tremendous, but it's only for a 5-year period. So what happens after 2028? And, who knows what's going to happen at that time. But when you think about long-term sustainability, I want to investigate a cost recovery model. And so what is that? Within parks, typically, when you look at the services and the facilities that provide more of an individual benefit, so these are like your campgrounds and your marinas, your pavilions or day-use shelters that are rented out, typically those are subsidized by more the individuals rather than the community at large. Whereas you look at these services that are more widespread, trails, natural areas, and just the greater day-use facilities, those are typically subsidized through the community at large. So again, we're looking at local option levies, general obligation bonds, we're looking at a special service district or a recreation district. So what that's going to be, I don't know, but we definitely need to explore this cost recovery model to have a sustainable funding source going into the future. Matt Ellis, I guess he's done. So we have a number of key initiatives, as mentioned earlier, financial stability and implementing local option levy is at the very top. But everything is really driven from our park system master plan. So this is our 20-year vision document. It was adopted by the Board of County Commissioners back in 2018. And so there are a number of strategies and goals within the master plan, and we're focusing really on 3 action plans. First of all, we want to improve the accessibility of our parks. So looking at a DEI lens, I've been working with Latife Amato, who's got this Equity Lens program. And so this gives us a great opportunity to make sure our parks are more accessible, both physically, we're talking about the folks, the culturally and socioeconomically. So we have parking fees right now, $5 a day. And so we're pricing some people out, that's unfortunate. So looking at some potential holidays like Earth Day or National Park Day where we can offer free parking. We also want to explore a program for folks who are of a lower income that may qualify for reduced or free parking. The 2 other action plans, we want to improve our park entrances. So those give first impression of our parks. The signage isn't always great. The landscaping and just in general, we want to improve the appearance of our park entrances. So that's been a big point of emphasis for myself as well as the Park Advisory Committee. And then lastly, we want to continue to enhance water access. So we're looking at mainly non-motorized boating access, which is really a recreation trend that we're seeing. More folks are recreating in that way, and we want to accommodate that. So we want to investigate that. We have a great chance of doing that with this 5-year local option levy. And then lastly, I want to mention a preventative maintenance program. So we do have a program in place, but it's not very comprehensive or robust. And so now that we have a couple of facility condition assessments, we have a better sense of our inventory and the condition of our assets. We're looking at our equipment and at our parks in general, our facilities. We want to make sure that we have a plan in place to prevent that further deterioration of our parks and to get ahead of the game, so to speak, by maintaining our parks better. So we've got a great opportunity here with this levy and the hiring of some staff, like a superintendent, which will help us establish a preventive maintenance program. So I'm really excited about that. And so I want to mention the covered bridges, and I told you I was going to go back to them. So covered bridges are in Fund 217, and so these are 3 bridges that are considered offline or off the county road system. And so they're a part of what we operate, and unfortunately, because they're no longer a part of the county road system, they do not qualify for road funds. So we have no source of revenue coming in to maintain those bridges. And so I'm wanting to work with other citizens within the county who are advocates for these covered bridges, especially in the Cottage Grove area. We have 2 of them, Curran and Stewart, which are over there close to Cottage Grove in the southern part of the county, and kind of come together similar to the way we did with the Parks Funding Task Force and think about, first of all, an initial investment that we're going to need to make to all 3 of the bridges to make them safe and to just preserve them into the future, but also thinking again about that sustainable funding source. So we're going to need to advocate both locally and within the state to think about what those future funding sources for the covered bridges will be. So that's about all I have, and I'll be available, I guess at the very end for questions, or now, whatever.
Let's do it at the end.
At the end. Great. Thank you.
All right, thank you.
I don't know. Oh,
Yeah.
that's fun. I'm done. I can't, yes. Now that I'm done shuffling a lot of papers. All right, good afternoon. So, waste management, these are, I love showing the different programs. I think people think we just kind of run a landfill and make sure the garbage goes where it's supposed to go. So, I'll highlight a few of these. Our fee collection staff are all the folks that work at all those transfer stations, 15 transfer stations, landfill, and assess those loads, ensure they get screened properly, and we assess those fees. Our transfer and disposal operations manage our transfer stations and the landfill respectively, so ensuring all the waste gets to where it needs to be, and the landfill that we're putting as much of that stuff in as small of a space as possible. We have our landfill development. That's a large portion of our reserve fund. So we have very large reserve accounts, and most of like our closure, post-closure funds are required in order to operate a landfill. So essentially you have to be able to, if you were told today you had to close a landfill, to have enough funds to not only do final closure, but then have 30 years of post-closure care. And then we also have that landfill development around developing a funding stream for the new cells as we run out of room in the current cell. Usually our recycling and waste reduction services people are very familiar with. We've also taken a heavy focus on policy, so looking into those EPR policies that are coming down the pipe and trying to advocate for more of those types of policies so that we can think about how to reduce the waste. And then our hazardous waste, people usually remember us for the household hazardous waste program. So that's that free program where folks in Lane County can bring their household hazardous waste in, make an appointment, get rid of that. Our nuisance abatement really works with the illegal dumping program on county land, and also some of the unhoused camps. Our closed landfills, we actively monitoring a handful, as well as keeping eyes on the rest of the landfills. A lot of our transfer stations are actually built next to old landfills that when the rules came out where you couldn't just kind of dump things into a hole and burn it or just kind of put dirt over it, they then became transfer stations. We monitored those. And then our environmental services, which has become a larger and larger part of what we do in terms of all of our permitting. So that's our LRAPA permit for the landfill, our stormwater permits at multiple sites, and that's becoming an increased load for us to manage, as well as our Quamash Prairie, which is the wetland mitigation for the landfill. let's see if I hit the right button here. So in terms of changes for next year, I mentioned environmental services, and so this is kind of a snapshot of the things that they work under. So we're creating additional positions. What's happened is that we've kind of piecemealed out a lot of the monitoring and the taking of samples for stormwater to a couple different areas, and so we're kind of overtaxing some areas and making it more difficult for them to do their other jobs. And then we also, the Quamish Prairie becomes a larger and larger one in terms of managing that. And then our hazardous waste. So a lot of these programs are kind of, we have the person at the landfill who's then coming to Glenwood when it rains to take samples, and then trying to go to Florence to take samples. And then El Rapa has a whole lot more requirements around our landfill that just came out in our new permit. So we're really stretching people thin. So we're trying to add positions there so we can have folks keeping up with that and support those areas as they become more and more of a burden for us. I say startup of the Cell Development Reserve Fund because we did deplete that fund doing phase 6. So we originally thought that'd be about 12 million. We then said, oh geez, it's probably gonna be 15. It cost 18. So we had we actually had 18 almost. I mean, we got a lot of revenue from the Holiday Farm fire, which also accelerated the filling of that current cell. And so we dedicated all of that funding to go to building the next one because it accelerated the building, the need to build that. We had to build it in 2 seasons, so there was some increased mobilization costs there. We had a whole lot of increases in just materials. Construction costs went up during COVID, as I think everyone knows. We had a force majeure for the landfill liner, so the storm in Texas, the ice storm, actually stopped production of landfill liner, and then you had to get in line to get it, and it was a force majeure, so they set the prices, and if you wanted to build a landfill liner, you had to pay them. So there were a lot of things that happened that were unanticipated that depleted that fund completely. We were very lucky that we had enough money to cover that, but we now have to aggressively build that back up to the tune of about 1.5 million a year in order to build the next landfill cell in 12 years. And so when we talk about that 7% increase, a large portion of that, darn near all of it's going towards that cell development fund so that we can build it back up. We also are just trying to absorb a lot of the increases we're seeing. We did a CPI last fiscal year, and we didn't see any of our vendors and partners giving us a CPI increase. They were all 7-8% increases. Our fleet contributions have doubled for next year. The landfill security, that on-site went up 7% starting in July. So we're finding that we're struggling to keep up with the increases being put on us. So that those 2 things are the big reason why we proposed a 7% and are doing a 7% fee increase, and we believe that should allow us to stay on the CPI in the future. So that large jump gets us to where we can put that $1.5 million aside, and then we believe that from here on out we'll be able to continue that $1.5 million and then try to stay at CPI in the coming years. And when we looked at that, it was if we did a 5%, then we were going to have to do well over CPI for the next couple of years. So we were trying to do that right now and then stay at that in the future. And that's what we've been able to do since, I believe it was 2014 when we did our last over CPI increase. And so we've been very successful in being able to manage with that. But as you can see, we had some outstanding circumstances. And then we are doing the design work and the public outreach work that the board requested us to do in terms of determining if we stay or leave Glenwood, including the costs. We'll be coming back to the Board of Commissioners probably in July to report back on the work so far and our plan for the next fiscal year to complete that work. And then lastly, just some of our key initiatives. So folks are pretty, know about our integrated material recovery facility. That's a huge initiative for us that requires us to work with our partners, our cities of Eugene and Springfield in particular, to partner with to try to get that to become a reality. Like I mentioned, we're completing the public outreach for the Glenwood Transfer Station, so we know if we leave where we should go, where it would work the best. as well as the cost for that. And then there are the extended producer responsibility rules. Mattresses come online next year, and the year after, there's a plethora of other materials that will be required to be recycled. Mattresses, super positive, excited about. Really don't want those in the landfill, very excited by that. The other rules are going to require us to do some upgrades at just about every transfer station in order to be able to collect the increase in materials that you are required to do. So we don't get to pick and choose. There are a certain set that if you are a transfer station, you're required to collect. There are some above and beyond that you could do. So we're analyzing that and seeing what that means, in particular at some of our smaller transfer stations that have very limited capacity, customer counts, and ability to do that. So those are some of the biggest things that we're thinking about in waste in the next year. Thanks. Now I think it's you.
Okay, good afternoon, everybody. So the Land Management Division is made up of 5 major program areas. The Building Safety Program, as most folks can probably imagine, involves our plan review and inspection services for folks wanting to build in rural Lane County. Code Enforcement is a very small team, 2.5 FTE, and they're responsible for all of the code violations and bringing folks into compliance with building and land use and sanitation codes in rural Lane County. We have our Coordinated Services Program, which is a newer program that's been added to the Land Management Division in the last few years, and this is a team that is primarily dedicated to customer service and then sort of eliminating that silo effect that happens in permitting offices sometimes, where you have building review and planning review and sanitation all kind of working in their own area. Coordinated Services was developed to try to bring all those work groups together and be one public face to the public. That's redundant. Then we have our Land Use Planning Group, which includes both our current planning and our long-range planning program, as well as our hazard mitigation team, which is our floodplain management team, and our FireWise program that deals with wildfire mitigation. And then finally, we have our on-site sanitation program as well. This budget year, we're actually proposing to eliminate 1 FTE initially. This is due to a funding loss. We added a fire permit coordinator position after the Holiday Farm fire with some funding through the state. Business Oregon, those funds have now sunsetted, so we do have to eliminate that position we're proposing. But I'll speak to it in a little bit. We are going to be likely to add an additional position later in the year. So, you know, unlike parks, unfortunately, I don't think we can convince the public to pass a levy to fund building and planning services. It's not quite as glamorous. So we are currently structurally imbalanced, and that's for a number of reasons. For several years, Land Management did a pretty good job building up a very healthy reserve. This was pre-pandemic, pre-Holiday Farm fire, where we got to the point where we had about a full year's operating revenue. That, some folks who've been on the committee before will recall, that's really was needed as a buffer because building and planning services can be so impacted by dramatic changes in the building and sort of that market that crash in building or development can really see our budget plummet because we're so dependent on user fees. And in order to try to mitigate that, we built a pretty healthy reserve. However, when COVID and the Holiday Farm fire came about, the division added a number of staff. Frankly, the division had been understaffed for a number of years, but for financial reasons, we hadn't added additional staff. The fire really kind of brought to light the fact that we needed additional staff in land management. We added about 10 FTE. At the same time, the county waived building permit fees for a number of residents rebuilding upriver. A lot of that money was supplanted with ARPA funds, but we continue that fee waiver program. That's going to go on for another 2 years until 2025. So we still are providing services without fee revenue. So that, in addition to the inflation costs, the fleet costs, the renegotiated labor contracts, all of the things that have been mentioned, we saw our costs skyrocket. So This year, unfortunately, we are structurally imbalanced. Again, land management's heavily dependent on user fees. We do not receive any general fund support, so primarily intended to be an enterprise fund where we recoup costs through user fees. Land management hasn't done a major fee increase in a number of years. We've just done periodic CPI-based adjustments to our fee schedule. We are, at the last time we did a major fee analysis was in 2015. We were on the higher end of our comparable counties in terms of our fees, but the majority of those other counties got revenue through other funding sources, general fund or other sources as well, so that wasn't a surprise. At this point, with the inflationary costs, the real desire and need to provide better customer service, and I'll talk about some of the initiatives around that in just a minute, we feel like if anything, we have just barely enough staff to try to push these efforts forward. So we're concerned about cutting back staff at this time, and really we need to find a sustainable revenue source. It's clear, it seems like it's not going to be general fund, so the other things we've looked at is really an increase in user fees. As part of the work this year, land management is going to be going through a comprehensive fee analysis to kind of study each of our processes, to understand our workflows and determine, are we receiving full cost recovery? In 2015, before all these changes in, labor increases and other things, we knew we weren't catching full cost recovery in about 70% of our in our permits and program areas. So we suspect fee study is going to show that again, that gap's probably going to widen in some regards. And then that'll be a policy choice that we bring to the Finance and Audit Committee and the board to determine, if fees do need to be increased. We're very sensitive to that right now at this time because of obviously the affordable housing crisis. Permit fees are going to impact that. So it's more of a balancing act and a policy choice for the board around how much customer service can we provide, because a number of our, as I mentioned, that coordinated services team, code compliance, long-range planning, these sort of functions, they're not funded through fees, so we need to figure out a way that we can either take some surcharges from some of those fees and keep those programs running. So, as I mentioned, we'll be losing that one FTE, or proposing to eliminate one FTE, but we're, like many other divisions in Public Works, we're taking on additional stormwater permitting functions, so land management's going to start issuing erosion control, stormwater permitting, starting January 1 of 2024. So probably likely in supplemental 1, there will be a request to add an additional FTE for that work. We're looking right now at a fee structure for that stormwater permitting. We're going to try to right-size the permitting fees to fund that position within land management. Let's see. We are at a really, the news isn't all bad. We're at a really good place right now in land management because, as I mentioned, for years we were understaffed. We staffed up to deal with the Holiday Farm fire and all of the work stemming out of that. That work is starting to taper off, and we're in a really incredible spot where we have resources to dedicate to some of these other things that have just really been put off for a number of years, things that we've had that we wanted to do. We have a number of technology projects underway right now. We are working with a consultant, a vendor, to implement an online permitting system. This is something that's been in the works for a number of years. There's real progress. I would say we're probably close to halfway or 2/3 of the way through that project, so we hope to launch a tool this summer that's going to allow the public to kind of work through the permitting process online with guided forms, and it's really intended to help us get more complete applications, let the public submit an application, on a Sunday evening. They don't need to come down to our offices, so really proud of that effort, hoping to launch that soon. At the direction of the board, we're going to be undertaking an affordable housing audit. Commissioners Buck and Senega and Dan Hurley have been working on an RFP. We want to go out, we want to study what are we doing now that is helping the affordable housing situation, what more could we do, and really kind of looking at it through that lens. What can land management do to speed up building, reduce costs for building projects? So that's an initiative. Happy to announce we're opening up finally. This has been something that's been on my wish list for a long time, a satellite office in Florence. So during the Holiday Farm Fire, we opened up a satellite office up in Blue River to help those residents, and that was really successful and popular. Land management, a number of years ago, back when there was lots of timber revenues and the department was flush, we had an office out in Florence, which is a great asset to all those residents, so they don't have to drive all the way down to Eugene. So we will be opening up a one-day-a-week satellite office in Florence. There's a number of other exciting things happening at the legislature right now that we want to be ready to go to implement, including the accessory dwelling units that will increase the housing stock. There's a number of other important statutes that are going to be turning into rule changes that we'll have to implement and update our code to implement. We also started a few years ago prior to the fire a pretty comprehensive code modernization project, which has more or less been put on hold as we've been dealing with rebuilding efforts. We want to kick that back off because really development and easy, clear, and objective development, which eliminates unknowns and risks for developers. The foundation of that is a clear land use code, so they know what the regulations are, so they can navigate their way through that. And our code sections of it have been out of date for decades and decades, so trying to modernize that. I mentioned the comprehensive fee study, and finally just doing some other low-hanging fruit to improve customer service, getting better information out on our website, and website redesign. So a number of things we're trying to tackle. We have the staff and the capacity. I don't know for how long we're going to have that. I guess it's going to depend on future funding, but right now we're trying to get as much done as we can in this period. So happy to answer any questions.
Thanks, Gary. All right. So then I'll give a high-level overview of the road fund. You hear Steve talk about the general fund being the mothership for the county. Well, the road fund's sort of the mothership for public works. We have 45% of our FTE are supported by the road fund within 3 divisions of road and bridge maintenance, engineering, construction services, and admin. So the road fund helps us preserve, maintain, and enhance our transportation assets. We have over 1,400 miles of roads and over 400 bridges to maintain, and this team is always working to carry out those maintenance and enhancement projects to improve the network, improve safety, develop multimodal options. And then wanted to point out culvert, fish passage is a big issue within road maintenance you wouldn't expect, but we have to do a number of very large projects to improve fish passages for culverts, and they're very expensive. But there is new federal funding for that we're tapping into. We have one project in the queue that we think will be funded for this upcoming fiscal year, and we're going to try to get one for the next 4 years after that to be able to help the road fund there. Looking at total expenses, about $70 million there. That's about a 23% increase over the last fiscal year. That's driven primarily by an increase in capital expenses, about an 11% increase there. Also about $1 million in personnel costs as we ratified the collective bargaining agreements and had some wage adjustments there. And then also the cost increases we're seeing with inflation and just other rising costs. Some comparison numbers for our resources from last fiscal year and this fiscal year. You'll see the first one there is for fund balance. We're looking at quite a jump there from 51 million to 75 million. We just wanted to point that out. That's primarily due to $20 million we're getting from the state for territorial highway. We did an exchange a few years ago where we passed off Delta Highway, and then we got Territorial Highway with $30 million that went with that. It's come in different phases. So the $20 million payment will come in this fiscal year. We'll have another $5 million payment after, and we already received $5 million. That's not nearly enough what we need for Territorial Highway. We're looking at well over 60 million. I think the last estimate 65 million or so. So that's going to be a challenge in the coming years as we try to bring Territorial Highway up to our county standards. One-time grants, you can see highway allocation just a bit up, $1 million. We'll touch more on that in another graph. One-time grants are down about 10 million, and that is really just sort of timing dependent based on projects coming in and grants that we are able to acquire for those projects. Looking at expenses, again, I mentioned personnel costs going up about $1 million, materials and services up about $1 million, and then that big jump in capital expenses as we carry out some big projects in the next fiscal year. We'll touch on the rest later. Pie chart here to talk about our reserves. Wanted to point out that Lane Manual has a requirement for the road fund to keep a 40% reserve, 40% of our ongoing operating revenue. That's broken down into 3 different components. We have a 17% emergency reserve, a 15% catastrophic reserve, and an 8% service stabilization reserve. That service stabilization reserve was huge when we went through COVID and people stopped driving and the gas tax, money dried up. So we've since rebuilt that. So those reserves are part of that reserve threshold. And then we have reserves for future projects. 19 million sitting there. We have many more needs than that in our transportation system plan. But this will keep us going into the coming years. And then our territorial highway reserves as we start moving through large phases with that. Wanted to point out where we've been with the road fund in our highway allocation, which is about 65 to 70% of road fund ongoing revenues. We saw a pretty significant jump starting in 2018 with House Bill 2017, which was the transportation package. So we've enjoyed that increase in revenues, but it's looking like that's going to start tapering off. And so that's a big concern as we continue to have increasing expenses and flattening out of revenues will cause us to become structurally imbalanced in the long term. That's driven by a number of factors. Actually, ODOT just, I think, downgraded their projected revenues for next year, and we'll have to look at adjusting those numbers. We use ODOT's projection, and it seems to change quite a bit. So pointing out some concerns there. It's driven by a number of factors. So again, we're balanced just to the positive, 162,000, not much there, and some concerns for the future. So some causes on that, those ODOT forecasts, which are a number of factors of what they expect people to drive, vehicle registrations go into that. But we are concerned with the long-term adoption of electric vehicles without that gas revenue. So we would want to see the board support looking at advocating for additional revenue from the state through other means than the gas tax. Talked about a growth in wages, increasing materials and services. The fourth one there, ongoing revenues from outside agencies. We're seeing that dry up a bit as other agencies don't have the project money to pass out projects for us to do. And also this fund exchange. There's been a program through the state where we could get federal money through grant money and then exchange that for state money, which reduces the cost for the projects because we don't have the higher level of environmental requirements on this project. ODOT is stopping that fund exchange program, so that's impacting our revenue as well. And I wanted to point out just another concern is employee retention issues in engineering construction services. Engineers are in short supply these days with all the federal money. They were already in short supply. We're having a real hard time keeping engineers. We have to bring on really green new engineers, and we spend a lot of time getting them trained up, and then they go off to the private sector. So we maybe need to look at shifting our model more where we have more project managers and contract out for engineering services. The projects are also becoming very complex, and to be able to carry out all the different things that need to be done for especially environmental factors, it's hard to keep that level of high trained engineer. And then also just secure rural schools. We never know what's going to happen with that, and we've been dependent on that through the years. So we will be needing to do some plans to keep our structural balance. Again, would like to see the state move forward with a usage fee for per mile use for vehicles. We'd like to have a conversation with the board about potentially supporting that for the electric vehicles that are coming online. The state's piloting a program now, and we'll kind of see where that goes. We will need to do a review of alternative funding options. We've done that a number of times through the years, which led us to pursue a vehicle registration fee, which didn't pass with the voters, but we may need to look at other options, such as levies or bonds, which the cities do. We do need to talk about stormwater fees. That's been an ongoing conversation with the board as those costs for managing stormwater keep rising significantly with a new permit that we got a few years ago. And potentially the formation of a utility district around stormwater, or some of the cities are exploring a transportation utility district. So I'm not sure how favorable the citizens would look on that, but other funding models we may want to look at. And then just a couple department-wide slides. The department supports the county's strategic plan in a number of ways with each of the county priorities. So Safe Healthy County, we focus on reducing traffic fatalities and improving traffic safety. We do that through the 3 E's, enforcement, education, and engineering. We can't do much about the enforcement side of it, although we try to support the sheriff with their secure schools money. But we spend a lot of time on the engineering and education piece through our fatal crash investigation team, and we have a systemic engineering implementation team. Vibrant communities, we've got a number of projects in the strategic plan. Some of those have been highlighted, such as the waste processing facility, also looking at a multi-purpose facility out at the fairgrounds, I'm sure you're aware of, and then implementing the parks action plans around the levee, and again, stormwater management. Robust infrastructure, just wanted to highlight, we're driven by our master plans. I wanted to call out a couple of them here. The Lane Event Center is currently working on a master plan for the fairgrounds area. That'll be a conversation with the board over the next few months. And then we recently completed our bicycle master plan, which has a lot of projects in it. It's going to get long-term funding to try to improve our multimodal transportation. We have emergency management out at Public Works. They're not part of Public Works, but co-located there, and we do a lot of work with them to improve our preparedness. So part of that is implementing the all-hazard mitigation plan. We're currently working with them as they're updating their natural hazards mitigation plan. And then finally, our people and organization ongoing efforts to improve our employee wellness, supporting efforts by human resources and around benefits in the Wellness Center, and trying to improve our employees' financial wellness by encouraging deferred comp and various things. We are active with our DEI work. We have an equity committee and have staff on a number of countywide committees there. We talked about financial stability, and then just the last piece about continuous quality improvement. Wanted to mention that we are launching a project to seek accreditation from the American Public Works Association, so that we make sure that we're implementing best practices and having all the documentation and procedures that we should to reach that high bar. So that'll be emerging over the coming year. And then finally, future challenges and opportunities. Again, recruitment, retention, it's getting better in the labor market, but we've had some serious challenges filling some positions, mechanics, some of our building inspectors and things like that, and engineers. Number of supply shortages, fleet's really struggling with that. We've been waiting for some vehicles for more than a year, trying to get those filled. We talked about price escalation, labor costs, increased just workload and regulatory requirements. For example, the stormwater, which we just keep adding more requirements that we need to do, and haven't necessarily been able to add FTE to cover those. Stormwater, talked about. Wastewater, we just added a wastewater staff. It's our first person on that's helping our special districts out there that are really struggling with wastewater issues. And then finally, grants and awards. There's lots of talk about opportunities out there. We've struggled to actually land those. There's the IIJA, the Infrastructure Investment and Jobs Act. It appears that most of that money is getting sucked up by the state or going out to these nationally competitive grants programs, And it's really hard, being a rural county, to show, the traffic volumes to be able to be competitive with those programs. So we'll keep looking at them, but we're not finding a lot there right now. And that concludes our briefing. Acting Chair Weber, if you committee has
So what do you guys do in your spare time? Well, do we have questions for Dan and his team here? Yeah, but you obviously, I'll ask something, and so we've talked about this before anyway, but obviously the road funds, that's, as you said, 43% or whatever, and that is gas tax. So that is just, that seems like that's got to be, as somebody used earlier, the elephant in the room. And
Yeah, especially with, the mandate to be, only selling electric vehicles in the state by 2035. So, yeah, something's gonna have to get there, so it's gonna take some legislative action. So the state is piloting a program where people can sign up and have their miles tracked, and there aren't a lot of people that have signed up for that.
Yeah, you wonder why.
Yeah, I wonder why, yeah.
But that may be the future, or very high vehicle registration taxes.
But like I said, that is the elephant in the room, it seems to me, that's a,
Yeah.
the whole thing revolves around having those funds.
Well, that and the fact that nobody wants to vote to increase the gas tax
Well,
for relative price increases. So, with both of those, it's really hard.
Do you know what the percentage of gas tax, because the significant portion of the state funding is also vehicle registration fee, and the state increased. There's a trend here where we've gone and asked the voters, and in this case of the vehicle registration fee, they said no, and then the state went and implemented an increase statewide, which really is a better approach. So, do you know
I don't know the
percentage of-
percentage. It's very heavy on the gas tax piece, but I'm not sure what the percentage is. But we can follow up and get that.
questions? This is the time, we have the group right here, Okay, again, I'll ask again. Okay, and I'd heard this before too, that Lane County has the highest fatality rate on
We
Lane
did a
County
number of
roads.
years ago, I think that's been about 5 years ago.
Is it better?
We're not the highest anymore, which is
We were number 2 this year.
but we're not.
That's because
not too far
somebody else
down
got
there.
worse, not because we got
Probably.
better.
That's right.
Yeah, I don't have those. There was a big.
We had
there was-
52 last year.
There was a big spike during COVID, as there was nationally. People just driving crazy out there, high speeds, a lot of intoxication fatalities. That did come down, I think, last year, but Warren, you might know better than I.
No, I do serve on the fatal crash investigation team, but I really rely on Becky Taylor's work to get us the stats around that stuff, so I'm not familiar.
We had a presentation 3 weeks ago.
Sure.
Numbers are fairly fresh. It's 52 last year.
But yes, during COVID nationally, it was over a 20% increase across the country in terms of fatal crashes, so it was, Lake County saw a reflection of it.
And our big issue here is
Enforcement.
enforcement.
Yeah, well, we heard
Right
that
now,
yesterday.
2 deputies covering all of Lane
Yeah.
County, and they're not doing any traffic enforcement.
Yeah, we got that clear last Thursday, I guess, there is no traffic enforcement, and that's, I'm guessing everybody knows that's out there driving and not paying attention or not having to worry about it.
Yeah, maybe one thing I could highlight around that, it's kind of tangential, but Lane County does have an MOU, a memorandum of understanding with our sheriff's partners for the Waymaster position under the road fund. So we do have some increased enforcement around the large equipment use of the county roadways, which is a strong safety concern around trucks. So example, our Hill encounter, we had a $16,000 citation just last week regarding an overweight of 70,000 pounds. And those vehicles don't have enough brakes to stop. So if they're on the county road system, they are creating a significant safety concern. So that's one of the partners we have with LCSO, is to try to combat some of those challenges in the county roadways.
If I may, Bruce?
Mr. Boydman.
So with respect to land management, obviously, development of new lands increases some of the tax base and has some impact on that. And I don't know, I assume we'll hear a little bit from the assessor as far as some of that revenue stream. But as far as new permits, how are we looking forward for the next fiscal year compared to, for instance, the past fiscal year for new prevention?
Volume, you mean?
Yeah.
Yeah, it's actually, we haven't seen that drop off that we had been anticipating, and we're actually gonna be finishing this year's budget with revenues exceeding what we were initially projected at, just because of some large projects, LCC, some large commercial projects. But the other thing in the county, it's interesting, there's just such pent-up demand for rural housing, so when it becomes available, when there are options, we see people take advantage of that, and they're not often the individuals who are overly concerned about interest rates. I mean, they're usually, folks with means, purchasing land and developing land. So we haven't seen a big impact on residential development yet. We don't anticipate, unless something, major happens, seeing too big of a shift. And then, like I said, we've seen a large increase in commercial projects.
Excellent, thank you.
Questions?
Oh,
We have another
Mr.
minute.
Trigger?
A while back at a board meeting, there was some conversation right after the levy passed about whether there was interest or appetite in exploring a countywide parks district that would fold in the other special parks districts, River Road, Glen Lane, and so on. Do you think that's even remotely feasible enough to be worth having those conversations and penciling out some of what would that, what are taxpayers paying now collectively, how to leverage it up? Would it actually be a ultimate, would it bring a total of more revenue enough in for people to kind of give up their own district? Do you have any sense of
Well,
viability
so
of that?
we explored that with the Parks Funding Task Force. A big deal, of course, is compression. And so the existing recreation districts are pretty robust around the metro area. But I think we could potentially carve out a space, and so we're looking at that. So we're looking at basically the Fern Ridge area to Armitage. That might be possible, but it's going to require support from the city. And so it's more of a long-term initiative that we're looking at.
Thanks.
Anything else for Dan and his team? Okay. Well, thank you, Dan, and other part of it, so. See you tomorrow. Thank you. Okay. We have 3 minutes.
Well, good transition.
Yeah, so we're good.
What this means. The problems of the past. Well, it's a little in the future. Yeah, right, fair enough.
That's good.
Someone's happy out there.
Yeah.
Spiritually balanced.
That's good news.
No, I just gave him $56,000 the other day
Hi.
for a project.
Yeah, they're not like there. Yeah, well, yeah.
Right here.
It's crazy.
Okay, great.
These seats.
Hey, everybody.
Hello.
It's been a long day for you all.
I had no idea they did that.
Yeah, I paid him $93,000.
Season, right?
$6,000.
That's just,
Isn't that insane?
yes.
It's insane. I looked at that, I'm like, oh, are you kidding me? Yeah,
mean,
because they
that's
claim,
why it's probably
they claim it's
premier.
impact.
There's probably the premier.
Yeah.
Any park districts, I mean, you gotta admit, they're pretty darn.
And they don't have an appeals process. They say they do, so they don't have an appeals process. So I'm sorry, we're still getting that group together. We don't know what to do. Why don't you just pick it or just discuss it later and give you a refund? I'm like, yeah, no.
Where I said anyway.
Yeah, that is pretty impressive. And I understand the sub part of it, of course, but,
What's the new park they built over on, by Hayden Bridge, or Hayden Meadows?
yeah, it's pretty nice.
Arrowhead Park, there's no place to park.
That was
All these people are parking in the neighborhood. The neighbors get all ticked off.
Hi.
It was supposed to be a neighborhood.
Whatever.
Well, that is what it was supposed to be.
Good. Yeah. We better.
I gotta get in the right spot.
Yeah.
For
Gotta find the right program here a second.
assessment, right there.
There it is, just can't read.
Room not crying.
Jeff tried to say that
Pardon?
he used all my, they're not impressed. Right, yeah. Well, trying.
Are we all ready to go? We're just missing Steve, but he'll be back.
Do you want me to start without him?
I think, well, Christine, should we go ahead? I mean, it's,
He's, none of this will be a surprise to him.
well, that's probably true.
But I like Steve, so
Yeah.
I'd like to be respectful of his time also.
Okay, well, you can just blame it on me, and that's fine.
Okay,
So,
thank you, Mr.
well,
Weber.
welcome,
Hi.
and it is your show.
Great, thank you. I'm Mary Vuxit Schaefer. I'm the assessor and the tax collector of Lane County. And this is my first budget presentation to this committee, so I'm excited. We'll leave it at that. Let me know if you have questions. Some of this is going to be repetitive for some of you, and maybe for others this will be education. So we'll get started. So the purpose of assessment taxation is to appraise property, calculate, collect, and distribute taxes. We do that with 3 different divisions: administration, property tax management, and appraisal. We do all of that for the benefit of 85 different taxing districts. I know this dollar bill sort of played out, but it's important because it really illustrates how much money the county gets. And I might point out that that 11 cents, that's a permanent rate, so that does not include the local options that the sheriff's office, the public safety, and then also the parks local options. And yeah.
Schools.
And these are all, examples of districts that we collect taxes on behalf of. Okay, so this is the nitty-gritty of our resources, how we get funded. The majority of our funding is through the general fund. We also receive funding through a CAFA grant, which is $900,000 from the state revenues. And I'll get into that in a minute. Tax penalties, foreclosure penalties, late filing. We get OHCS fees, miscellaneous fees, and application fees. That makes up the rest of our funding outside of the general fund and CAFA. The majority of that other funding, the $500,000, that is specific to personal property, real property, late filing penalties. Get 2 minutes to make sure that I'm not missing anything there. Utility, property late filing. So I knew I was missing one. So personal property, real property, and utility late filing penalties. And does anybody have questions about this slide in particular? No? Okay. So the CAFA grant. This grant this is okay. This is the County Assessment Function Funding Assistance Grant. It was created because there was inequities in the property tax system, specifically in assessors' offices statewide. This was created, or implemented, I should say, was created in '98. And it was implemented in '99. And it was created to fund counties' assessment taxation offices between 30% and 40% of the cost to run those offices. And it's 3 main sources of funding at inception were recording fees, a portion of delinquent interest on property tax payments, and then state general fund contributed $5 million per biennium, but that was eliminated in the biennium of '09 through '11. So, and then for '23-24, we are expecting about 11% of our expenditures from that grant, which is about $900,000. We're hoping that we land there, could be more. One thing I will say is we are a donor county, so for those of you new to this board, what that means is we collect more in recording fees in Lane County than we receive from the grant. So that's always something to think about. With the market, interest rates, I think last time I looked, are about 6.5%. People are still willing to buy, there's just not a lot of inventory. As we move into spring and summer, we're hoping that inventory increases and the interest rates stay, flat or decrease so that we see more recordings. And then the delinquent interest, so this is delinquent interest on paid property taxes. So what that means is when that delinquent interest decreases, when those deposits decrease, it means that people are paying their taxes. So, yeah. Does anybody have questions about this before I move on? Okay. For our expenditures, we are expecting a normal increase in M&S and personnel. We are, as it is, barely meeting minimum statutory requirements, and staffing is really far from optimal levels. We are gonna hold positions open longer to meet our vacancy variance of 5.5%. And our FTE is changing from 50 to 49, the deputy assessor position that was a limited duration, bless you.
Thank you.
And we continue to be judicious with our funds. And then we're always looking to create opportunities to modernize productivity, quality, and work output. Expenditures. I kind of want to liven this group up. It's been a long day for y'all. Okay.
Being the last one.
So, the administration division, there's 3 of us. It's myself, my executive assistant, and the management analyst. And we are in charge of oversight of the department for personnel planning, goal setting, budget, CAFA, stuff like that. And I'm just going to move on to the next slide. So one of these are just, y'all have seen these, right? This is a template, so, okay, I don't have to go through and explain what all this is. The key initiatives for 23-24 is, again, modernizing, focus on safety. We've seen I don't know if it's an uptick or just, maybe it's just being called to our attention more, but there's more of a need for safety for our employees in the field and in the office at the tax payment counter. And we have intergovernmental relationships that we're fostering right now. One is with U of O Policy Lab. So we are working with them to look at different, are we leaving money on the table with the amount of FTE we have? Are there permits we're not inspecting? So we've identified a group of sales that we have not inspected that other offices, maybe if they're fully funded, assessment and taxation offices would have inspected, and looked at new construction that is a Measure 50 exception event, therefore adding revenue to the tax roll. And that, that's not one-time funds, as you know. This, when we add new construction, that is plays into the long term of the 3% maximum assessed value growth once it's added to the roll. So we're working with them, and actually they're going to be presenting. The timing is interesting because they're presenting to the board on June 14th. And so what we're hoping is that they will indeed say, yes, you're leaving money on the table, and more FTE would help you recuperate that money. So I'm planting seeds for future budget sessions.
Hearing.
Yeah, we got that.
Yeah, I'm pretty confident. And in the small amount of data that they're looking at, it's 400 accounts. It's 400 or 500 accounts. It's quite a large amount of money. And our original group that we were looking at was over 4,000 accounts, and they can't data sleuth 4,000 accounts. So they really had to narrow the scope, and that's only in Eugene, so that's not the rest of the county. So, an idea. We are, legislation, I'll get to that. And leadership transition, timely certification of the tax roll. Mike, if you're listening, I know he's listening. That's in every slide, and that's the legacy of Mike is the timely certification of the tax roll is with every division in our department. So property tax management. Property tax management is responsible for so much, but maintaining accurate records, all the cadastral maps, applying special assessments, administering all the deferral exemption programs, all the public information contacts, all the accounting, taking in all the money and distributing it to the correct funds. So
That is property tax management. They have 25 FTE, and they do a huge lift for the amount of people there. Questions? Very good? Okay.
Of course, any one of us can do your job.
Oh, yeah, absolutely.
Would we want to?
Lever. And then here's some key initiatives for property tax management in 23-24. We're going to upgrade cartography to ArcGIS Pro. That's underway. Since the beginning of '22, we've had about 40 to 48% of the staff is new, I think closer to 48. And so we're in training constantly, onboarding and training. Processing overpayments and refunds. I don't know if y'all have heard, but there's some new districts. There was 2 fire districts that dissolved and are combining into one with some additional properties. That's been a huge lift. We've partnered with, not me, Danny Arbatska has partnered with the county clerk, Dina Dawson, to really go through that. You know, I don't know that the process was clear as far as what the entire county did, and now there's a little bit more of a clear path and some more collaboration on that process, which is great because fire districts are they're popular for obvious reasons. And we have our tax statements are available in Spanish on our website, and we're looking to expand that to other languages. And we have 300 boundary line packets completed and estimate about 250 more before the end of the fiscal year, and that subdivisions, partition plots, lot line adjustments, stuff like that. So, and it impacts more than just 550 accounts. There's multiple accounts, sometimes hundreds if you're dealing with subdivisions. Think Marcola Meadows out in Springfield, there's 4 phases, I think, 4 or 5 phases of that right now. And there's each one of those tax lots has an account number, a map of tax lot, an owner. So we track all of that and keep it updated so the right owner can get their tax statement. And conversely, we can get paid. So the appraisal division is, the purpose of it is to value and assess all the properties at 100% of real market value as of January 1st each year. We do that by mass appraisal. We do real property valuation, personal property valuation, appeals, Measure 50 calculations. This is where the field inspections happen. And we have 21 FTE in this division. And we calculate special use assessments, exemptions. I don't know if I said that for property tax management, but it's, if one division does one thing, the other does the second part of it. So it's always shared. If there's an application, then there's the processing. And then it's like, okay, well, how does this impact the value, the ownership, that type of thing. Again, 100% of real market value as of January 1st, 23. The ratio study training, mobile assessor, we're going live in 23-24. That was a little bit delayed. You know, technology always goes as you think it's going to go, and then it does something, technology, that you have to address and sort of work out some of the wrinkles. And we are collaborating with other counties on best practices. We have found that that's really useful in just our processes and procedures, getting more efficient. Yeah. Questions about?
What other counties are you working with?
Oh my gosh, Benton. We went to a group of, our mobile assessor pilot group went to Benton County. They have mobile assessor, and so we thought, well, they must know how to use it. So we go there and, you know, learn. Turns out we were training them on some things. There were, COVID, I think, stalled their rollout. But they also taught us some things. Yamhill County, same thing with mobile assessor. And Lynn County recently hosted a commercial appraiser collaboration group where, you know, all of the counties got together, all the commercial appraisers, and, you know, talked about best practices, talked about appeals, talked about income approach, how do you value, you know, big box stores, how do you handle this type of appeal. So, yeah. Am I missing? Okay. Any other questions on this? Yes.
If I could real quick, interesting point, when you do a subdivision, when
Yes,
all those,
sir.
you take a piece and
Yeah.
look at all those parts, does that, the net tax value of all those pieces equal more than what the original parcel?
Absolutely,
Because it
that's
adds
a Measure
value by-
50 exception event.
Okay.
Yes, so, yeah,
Yeah.
absolutely, that's a good question.
Yeah.
So at the time it's platted, it's bringing in more tax revenue, is that right?
Yes.
Okay.
Yeah,
Individual lots,
yeah, instead of having one tax lot,
you've got
you have
50.
50.
But in response to this question, is it also incremented based on what the improvements are on their property as well? I mean, like if it's just bare dirt one January, then it's a house next January, of course that changes, right?
Absolutely.
Yeah.
And, you know, we do a percentage, so if an appraiser goes out in December and the house isn't, you know, it's just foundation and.
Right.
Then we only add a percentage of that new construction, and then the following year, then we go back out and we follow that property until that construction is completed. Yeah. Changes, we don't have any huge changes in FTE, which is great. We're just going to continue strengthening our intergovernmental relationships. U of O, City of Eugene, Springfield, and County Council. We have a lot of what we do is also appeals. We go to the Magistrate Division. We start with the Board of Property Tax Appeals and then the Magistrate Division and on up through Tax Court. So with the changing of the guard, if you will, in our office and then also County Council, it's really given us an opportunity to look at processes and you know, make sure that we're doing everything according to how, you know, what's legally permissible, that our appraisers are working within their guidelines, and County Council is giving us the support that we need to represent the county on those appeals. And we have, one change that we do have is a department-wide onboarding plan, which has been great. And it used to be, you know, if somebody was hired in appraisal, they were in appraisal, and same with property tax management. And now it's department-wide to give people, you know, a little bit more of the, what are we doing all this for, right? It's like sort of bringing back to improve lives. And that can start here as a department, and then it can sort of silo as time goes on after that onboarding. But that's a really important piece of our training. And with so many new people, we have an opportunity to do that. So website enhancements for manufactured structures, resources and information. Cross-training, so we get all of the improvements sketched into our database, which is important. And then having our tax insert available in multiple languages. And we're trying to rewrite some reports, our SAL reports, which are summary of assessments and levies reports, that need some revamping. So that we're sort of an old school access database written, and so we need to modernize those reports.
Access, really, sorry.
Oh, yeah. 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 Did I get that right, Randy? Good, okay, good, yeah, mostly. Did you say mostly?
That's the answer I get. That's the answer I get, Mary, when I ask that question too.
Yeah,
kind of.
Yeah, sort of. So what assessment taxation did, I'm not going to read all of this to you, but in '21, in response to the county strategic plan, we wrote a strategic plan. I was not on the management team when they wrote this, so if you don't like it, no, I'm just kidding. And a couple of things that we really wanted to focus on is enhance customer service experience for taxpayers on our website, in our office, increase efficiency and effectiveness through our business process review and revision, and cultivate a professional work environment so our employees can grow and thrive. Some of the areas of focus are modernizing our technology and how we communicate. And let's see, what am I forgetting there? Say again? Accuracy. Accuracy, thank you. And yeah, accuracy of our property records. I don't know if any of you know Eliza in in HR, but she's a local government buff, if you will, and she gets on other websites of different counties all throughout Oregon. And apparently, Assessment Taxation has the best website for data sleuthing. So, yeah, that's what Eliza.
Lane
reported.
County's,
So-
yeah.
Lane County's very good.
Yeah, it's very good.
Yeah, it's
It is.
great. You know
Yeah.
Eliza?
No,
Go,
no, yeah,
go meet her and talk to her.
yeah,
Because
but
she-
Lane County's is really great.
No, but your
Yeah,
website's
it's
very
great.
good.
Yeah.
So,
Find out information.
Yeah, okay, what else do I have? Okay, so future challenges and opportunities is, you know, you all know we're in a full legislative session. It ends June 25th. And there's bills that will add more unfunded mandates to our work. Boy, a lot. I know that Alex Kyler and Steve Adams are going to give you a legislative update in 2 days. I will just give you, you know, real quick. There are some legislative concepts that have turned into bills that will impact our work a lot. One of those is House Bill 2086. It allows for a correction of maximum assessed value up to 5 years. So now it's just the current year, and this bill, which it's got legs, it's probably going to cross the finish line. We would have to roll back value for 5 years instead of just 1 year. And we have to change our tax statement. So that's not only an administrative lift for us, it's also a financial impact to us because we have to change our tax statement. So then there's 3 wildfire bills. And those are meant to give relief to people impacted by the Holiday Farm Fire. So administratively, those are, they're not written so that assessors can implement them easily. That being said, Osaka and I'm on the Osaka Legislative Committee, and they know that, and so our lobbyist is conversing with the legislators that wrote that, and they're trying to work out, you know, okay, how can we make this, change it so that in a new form going forward, it's administratable. Yes. And then there's some enterprise zone bills that will extend the sunsets on those enterprise zone exemptions. And House Bill 919 provides a 5-year property tax exemption for newly constructed accessory dwelling units. And that one is in its current form is written so that it's going to be hard for us to administer, but hopefully they're listening to fixing some of those wrinkles in the language. Actually 2 bills that are of particular interest to us is stabilized A&T funding. It's House Bill 2088 and 3386. So statewide, it's known throughout all the districts that there's a problem with assessment taxation funding, but nobody wants to pay for it. So what these House bills are doing and what Representative Nathanson is doing is saying, okay, let's have a work group. We understand that this can't come from one place, it can't come from one district. So let's diversify, you know, how we're gonna fund assessment taxation. I think with the state general fund money coming out of the CAFA funds, years and years ago, we've never sort of recuperated that 5 million, and then secure rural schools and recording fees, and, you know, we're just subject to these huge fluctuations in the market. So I have a draft that is a potential mechanisms for state-provided A&T funding, and it is dubbed, or how to upset every single interest group in the capital. So, you know.
I like it.
Yeah, it's great, it's everyone, nobody's safe from it. So it's, you know, things like getting a percentage of the local permit fees to statewide site development costs. You know, districts, school districts, cities, nobody likes it in their line item, but I think hopefully at these work groups, you know, they can come together and say, okay, maybe the state general fund can, and maybe the SDC costs, and maybe the permitting fees, and the districts maybe can pony up a bit. So, yeah, more to come on that. And AOC has a voice at that table, so just to put that out there. And let's see. modernization or modernized computer system. At some point, we're gonna have to update our computer system. I won't get into that yet. It's not gonna be next year, I don't think, but there's movement with other counties that are moving away from Amentum, which is our current vendor. For us, I'm not sure that is, we just don't know yet. So, and we're not gonna make a decision haphazardly. So, and to be quite honest, what we have is robust enough to handle our 181,000 accounts. So until there's something better, then we're gonna stay where we're at and keep sort of patching it and doing what we can to keep it intact. And then retention of institutional knowledge, we're working on this. So that's part of our strategic plan. It's rolled into all parts of our strategic plan. And then paperless statement enrollment, we want to increase that. That's it.
All right. Do we have any questions?
I just have
Oh, go ahead.
just a quick question. Your 49 FTE, what's
Yes.
the right number
Ooh,
for a county
that's a
our
good question.
size? And because you are clearly one of the highest leveraging funds, and so I know being understaffed means we're probably underutilizing our
Yeah.
leverage capacity.
Thank you for asking that. That's a good question.
Where do
And
those two things cross?
the Department of Revenue in November of '22 came out with a report with modeled FTE per account for all counties throughout the state. And Lane County was modeled, we would be 74.96 FTE, or 49.
50% increase.
Sounds like the sheriff's office.
Commissioner Lovell, did you have a question?
I did, thank you. One of the things you said, Mary, back in, when you kind of skipped over some things, you said that there was some concern about employee safety in the office and the field. Can you give me some more detail on that? I mean, that kind of struck me as like, wow, maybe we should reinforce the office or something, or are people coming in really irate lately, or what's going on?
Yeah, so, thank you for asking that, and,
good
we have duress alarms in all of our front counters and in all the offices in our vault. And we, a couple of weeks ago, had a gentleman at the counter who just talked about, let me paint more of a picture. He didn't just come in and was upset. He is at risk of losing his property. And the person, actually I think I gave you her resources, Rachel, is working with him to get homeowners insurance so he can qualify for deferral so that his property doesn't get foreclosed on. Well, lack of resource, I'm not certain his circumstance, but he got really upset and threatened to come in and shoot up the county people, and then if the sheriff were to come out and seize his property, like do the same. And so we pressed the duress button. Deputies were deployed to our office, and the situation was de-escalated. But, you know, we have appraisers going in the field, and they, our current policy is that they cross two boundaries, and they cross two gates, they cross no trespassing in a gate, and we've just had, as of late, some instances where maybe that policy needs to be looked at again and revisited, because, I don't know that is gonna be, we don't wanna be reactive, we wanna be proactive with our people, right? So that's.
But you don't want to have unmitigated risks either. I mean, part of my experience why I asked that question is, you know, sometimes there's some people that, on properties we've developed, there's been, and no sexist comment intended at all, but a young woman comes out by herself, and, you know, it gets intimidated by some of these construction workers and such, and it's kind of, that's kind of alerted me, it kind of bothersome. And when you say be proactive, maybe, you know, they come out in pairs or something, or they come out via an appointment rather than just show up. I mean, you know, that could be help too, I don't know.
Yeah, you know, I appreciate the ideas. We're actually doing, we're doubling up right now on rural properties we have an opportunity to do that with work right now. You know, we have 5,000 accounts 5,000 permits, and between permits and sales that we inspect each year, so we can't make appointments. People don't give us their phone numbers. And it has been common practice, and I've inherited this, you know, we have to go out and get the value, we have to go out and inspect these properties. How we do it, can we look at that and change it going forward for people's safety? Absolutely.
Yeah, okay, good. One last question that's totally on the other side of the spectrum. A person has asked me and emailed me yesterday about the coming possibility of land patents. Have you seen any of those come through your office yet? Anybody trying to file a land patent? It's through the, constitutional national movement of such. People are trying to do some,
where they're
that kind of thing. Right, so I'm just kind of wondering if we started seeing that in the county or anything?
Yes.
We have. Have we filed any of those yet, or what are we doing with those?
I don't know that they come in as land patent, they come in claiming to have land patents, but I don't know if they came in to file, they would have to start with
Deeds and records.
deeds
But
and
it's-
records.
Yeah, they're just claiming that they already have one, and
Yeah.
therefore they're not supposed to be taxed.
Yeah, yeah, and
Okay, well, just keep me posted on that topic if you could. That's of particular interest right now, yeah?
yeah, yeah,
Anything else? I have a quickie.
yeah.
I'm sure I heard Steve say in the pre-message that, okay, and I heard you here that you collect tax from 85 taxing districts, correct? And then you disperse the money out, but you collect no revenue for that, is that correct?
Correct.
Okay, my next question is, why? Not against you, I didn't mean that,
Sure,
but,
yeah, no,
Banks wouldn't do that.
so when CAFA was created,
Okay.
it was to
That's what I
mitigate
thought.
that issue.
Okay.
But now that CAFA is declining, here we are having that conversation again. You know, we're looking at a deficit, and we're not alone in that, right? There's, you know, you
well,
look
that has to
around.
take a significant amount of staff time and whatever to,
Yeah,
I mean, obviously, and.
yeah, you're right. So, say again?
So just providing a function for free.
Yeah, I mean, they're unfunded mandates, and they are with every House bill, everything that passes. We have to figure out a way how to do more with less.
Is there any way that a county can go on strike against the state, just to kind of make a point? I don't know.
Well, so that's a good question, and we would risk our CAFA funds, and also the county would risk their cigarette and alcohol, is it cigarette and alcohol tax? Yeah, so the sin tax, yeah, you would risk not collecting those. So you can, as a board,
I see.
and you're risking a lot of
I wasn't
public
advocating,
funding.
I figured
Yeah.
there was a, yeah,
Yeah, there's teeth.
behind it that was, that you
Yeah.
kind of, so you said you basically look at 5,000 existing properties a year, is that what you do as far as?
That's what we do, yes.
Okay.
And those are the outliers, and when I say that, I mean, could we, with more FTE, go out and inspect more properties? Yes.
So obviously, if you have something on the, it could be 20 years before anybody actually comes out then, is that correct?
Yes, and Mr. Weber, one thing I'd like to highlight is when Holiday Farm Fire happened, and the aftermath of that was, you know, legislation got passed so that people got a benefit of a tax break. Well, some people came to our office and they said, well, this burned down, I need, you know, my taxes readjusted, and we didn't have some of those improvements on the tax roll. So we weren't even taxing them.
Wow.
We haven't been to.
So no permits.
There's properties in this county that we haven't been to in 30 years.
Okay.
Yeah.
Commissioner Beck?
On the previous question regarding the CAFA grant, is it required by state law that if we accept the CAFA funding, you're unable to bill the taxing districts?
That's a really good question. And I don't know 100% the answer, but I can definitely follow up.
That'd be interesting to know.
Yeah.
Is it, if it's that, or if it's some other state law that prevents that from happening.
Okay. I will find out
That's a good one.
and get back to you.
Does anybody else have something for our friends from the Tax
I'll
Next?
email assessor in the interest of time. I have a
Okay.
All right, again, thank you very much.
Thank
Very
you.
good.
Good work, yeah.
Thank you. Have a great day, everybody.
So I think do we have any business we have to attend to? Whoops, I should ask that question.
The only thing I would mention is that we've talk about the time that we have on the schedule available for other presentations. So has anyone thought of anything? Because we have not heard from any committee members. Anything you would like to hear more about or that you didn't hear about?
Does anybody have anything before I bring up my?
Go, Herb. Do it, Herb.
Actually, and this is more of a kind of a personal statement, but if am I correct in that kind of leaves some extra room in the agenda for the next meeting? For it to go
Correct, we
to one?
purposely left a block of time.
And maybe, and I do have I have a conflict that doesn't let me leave Cook on Thursday until 1 o'clock. I don't think I can make it here in 30 minutes, so I will be late on. I was wondering whether the committee would be open to changing the start times of 2 p.m. From 1:30 to that dispense. Yeah, that half an hour.
Well, that impacts staff and.
We can double, it's legislative, yeah.
Yeah, we can, we have legislative update scheduled, so we can check with staff. The committee, I don't know, other schedules, but the committee's desire.
I guess if it, I propose it if it doesn't conflict with the availability of staff to make that presentation.
Okay.
But I'm okay if you say no to that. And to speed up the meeting, so.
Okay, I guess you can check with that and send us out an email for that. I assume we can do that. and-
Yep.
I mean, I'm fine with it.
Take no objection. Thank you.
All right.
I just want to thank Christine for adding that leverage column to the
Yes.
Sosthorn summary.
Yeah,
Appreciate
that,
that.
that was good. That really,
Jennifer did, but yes.
So we'll have time Thursday, you'll get a legislative update, and then it's really time for, follow-up. We can respond to questions that have been asked or other.
Yeah, Michelle's taking notes on any of the questions that we heard today that you didn't get answers to, so we'll try and get those back to you. And we'll talk about the process for deliberation, which I know we have some new members, so the committee kind of has a defined process of if you have ideas, emailing them to me, we kind of run a checklist that night to kind of help keep it organized. So we'll just kind of look at that and see if the committee has any other thoughts and get ready for the next Thursday. So you won't meet on the Tuesday election day, so we won't meet again for a week after this Thursday.
okay. Anything else for the good? Then we are adjourned. Thank you, everyone.